All right. Do you have the YouTube link?
Yay, I do.
I'm
There we
going to send
go.
it in the chat.
Hello, we're all back again. Sorry about that. We are live now, but I will. I'll send out the YouTube link to you guys. Ugh, we're getting better though, little by
Okay.
little. Yeah, we didn't go too far, right?
Not with Clayton. No.
Technical
I mean, we always go too far.
difficulties.
That's our nature. But yeah.
I did tweet it out. Live stream is back up. Clayton, we were discovering that the YouTubes, when we tweet them out, like they get buried.
Yeah.
Have you noticed that with different kinds of tweets you do?
What do you mean buried?
It just doesn't get any engagement.
Suppressed.
Oh, I don't know. Haven't had any YouTube links.
Well, you got to get on that.
I'm tweeting this out, and then we can start formally again.
All right. Should we do the whole pilot bit again?
Sure.
Don't make me turn this plane around.
Yeah, exactly. Plane crashed.
Pretty much.
That's what happened there.
All right, let me know when you've tweeted it out.
Yeah, I just did. Oh, wait. Did it go? Oh, my gosh. Yeah, I just said we're back after. Yeah, my friend Theophilus, that's not his real name, but like Theophilus, he's like messaged me on Twitter. He's like, I don't know if you know this, but after Eric went out, your broadcast ended. I'm like, oh, shoot. Yeah, we just figured that out. Sorry.
I got to figure out why that happened, because what I do is I actually invite myself as a guest so I can use my other camera.
Right.
And guests they shouldn't have control over the broadcast. I got to figure out what
Yeah.
I thought I could just quit out without affecting anything. But anyway, my fault. I'll get my demerit for technical tomfoolery. So
yeah, Pamela in the chat's like, yay, sorry, Pamela. And we kept talking too. That's the thing that people need to know.
Show.
It was great.
Clayton was on flames. I mean, the charts were off the charts.
Oh, yeah. And then Rochelle Walensky came into the chat, and that
like she's not available anymore. She only had a couple of minutes to join us, but it was golden. We were breaking news there. It's such a shame.
Gosh. All right, we're back. I'm Jessica Hockett, joined by Eric Hartman, and we are joined by our guest Clayton Cobb, also known as Hold2 LLC on Twitter. And now he has two different accounts, one under his real name and then one under his business name. And he is joining us today to talk about an article and some associated research that he has done really over the past few weeks. I think you've been working on this, right, Clayton? But you, Blaze Media, published your article, How Prominent Public Health Agencies Are Skewing Vaccine Effectiveness Stats in the U.S. #DenominatorGate. That's a mouthful. Welcome to our nascent podcast, Clayton. We're happy to have you. Why don't you give us a little bit of an overview, kind of a 50,000 feet view of just this article, your research, kind of how you came to it. Maybe start with the headline. What does that headline mean? What did you find?
The headline means that in an attempt to differentiate COVID outcomes between vaccinated and unvaccinated people, the CDC and New York City, which I know the most about because that's where I've spent the most of my time and I live here in New York, they have been putting out metrics and rates that make it look much worse than it actually is for the unvaccinated cohort. Mm-hmm. And I didn't know that at first. It seemed intuitive because the US was putting out multiples like 41 times higher, 68 times higher, 97 times higher. But we were seeing in places like Denmark and the UK, and frankly, even some where they're maybe higher than UK and Denmark, like Switzerland or Sweden, plus we had Israel data for a long time because they were one of the first to ramp up, that these numbers didn't make sense. Now, sometimes it was because they were separating boosted from fully vaccinated and fully vaccinated from partially and partially from unvaccinated. And they would try to compare the absolute worst, unvaccinated to the absolute best, the recently boosted. But even those ratios seemed way off. But you can't just say these seem way off. I mean, the regular populace they may say that just sounds ridiculous. They tune it out, they move on, right? They don't listen. But there's a large portion of people that are making their personal decisions, their family decisions, their travel decisions, their school decisions, and even, of course, public policy. They can't ignore it. If they see this president say the unvaccinated are 97 times more likely to die than vaccinated, well, then local departments of health in local counties in North Carolina, or of course the Department of Health in New York City, they're going to act upon that. So I felt like I needed to really dig into it and see if I could determine the classifications, the definitions, the actual raw data underlying, and see if there were any issues. And I found a bunch of issues that make a huge difference. And my research is the culmination of finding those issues, putting them on paper, but also putting them in charts and databases to determine like what is really happening here over time. And so I have a little presentation where I'll be able to walk you through the progression. But that article was an attempt at taking everything that I had learned and put it into a story that is both readable and understandable by the average person, but still is supported with facts, sources, links, charts, quotes, and that's what you see there. So.
Right. Well, and to be clear, I know you've said this to Eric and I that you're not trying to discern motive here, right? You're not trying to say why it's happening, right? Or why you're seeing what you're seeing. It's just more, okay, this is what the data is and isn't showing. I don't know if it's intentional. I don't know if it's unintentional, right? But I'm just looking at the data, and that's really been your MO this entire 2 years, at least since I've been following you and interacting with you. You're really good about that. You don't try to say that like this is part of a grand pandemic or a conspiracy effort, right? It's just look at the data. What does it tell me?
That's it. And when we were talking earlier, but I'll say it again, I do have an inherent bias because, like you guys, I don't like what's happening. I don't like the medical authoritarianism. I don't like the fact that departments of health can lord over us. Like it's happening in New York right now. Our governor does not have the power, because there is no state of emergency. She does not have the power to do an executive order for masking kids. So what does she do? She goes to the Department of Health and says, hey, do this regulation.
Sure.
And then, well, how does the Department of Health have power? Well, the Supreme Court said they don't. But then they appealed. So now the appellate court is trying to decide, how does this work? Why is the default that the Department of Health gets to lord over us and do whatever they want unilaterally? Right. Is it because they have this data and they go, oh, see, the data is so extreme that it's worth it? Well, it's not that extreme. And that's what I'm trying to do, right? I'm trying to bring it back to, is this the difference or is that the difference? Because it's not this. Is it this, or this? And I'm not trying to say it's opposite either. I'm not trying to say that the vaccines are not useful or effective. I would really have to twist the data to make that claim, and I'm trying not to do that. Right. But what I have found is that there are big differences between what they're showing us and what reality is. And I don't know if that's intentional or not. I do believe, and I put in the article, that I think there's a lot of well-meaning, well-educated public servants, that's what they are, that are trying to do the right thing and do their job. Maybe there's a few people in there that have a political or motive or something, and they're setting the rules, and then the rest of the people just follow those rules. I don't know. Sure. I have no idea, and I don't even want to believe that. What I want to do, though, guys, is uncover it, show that it's clear and repeatable, that anyone can check it without me just speculating and making stuff up. And then I want those in power to acknowledge it and go look at it. Because if they don't actually know this is happening, they need to see it, they need to acknowledge it, and then they need to explain why they think that's okay, or they need to change the methodology and start showing it the other way so that then we can have a proper conversation. But what's happening is, with only Blaze being willing so far to publish something, of course it gets dismissed a lot by people that, oh, Blaze is right-wing, yada yada, conspiracists. That has happened a lot already. Well, I need New York Times or the Atlantic or Vox or someone to go, oh, we actually have a problem here. Like how Apoorva did the CDC article.
Oh, yeah. Right.
like
Right.
less than a week ago. Like
Right.
we need, oh, it's okay to talk about this now. Well, here,
Sure.
she was just talking about it sort of at a grand level. I have it at the data level. So why don't we combine those two and just get back to normal? Because right now it's still all skewed in one direction.
Totally. And we've been seeing this throughout the entire pandemic, right? Everything from the Johns Hopkins case ticker, right, which popped on the scene in like spring of 2020, and a lot of people were like, where are they getting these numbers? Are these actually official? They certainly, act like that they're official.
Yeah.
To even the numbers that we get for masks on the CDC's mask study site, which they supposedly use this list of 13, 14 studies to force mask our children, right? These studies are exactly what you were just talking about. They're claiming like 80, 85, 70, 80, 85% efficacy against COVID for masks. And to your point, most clear thinking people know that it's probably not that much. It doesn't bother them that they're being lied to. And then they it seems like that they compromise with themselves to say, yeah, it might not be 80%. They're probably exaggerating a little bit, but it might be like 20. So I'll just take that.
Mm-hmm.
Right. So this dishonesty through data, which is what they're doing. And I think that I don't want to speak for Jessica, but I totally agree with you that I don't think most of it is malicious or nefarious. I think it's just hubris and stupidity, and this noble lie where they seem to actually believe the more scared, right, they can make people, the more likely we will be to comply with their crazy strategies.
Right. Right. Well, and at least here in Chicago, we have a mayor and a public health commissioner that they're pretty upfront about what they're trying to do with like these mandates, like the vaccine passport mandate, which does now expire on Monday. But the mayor out and out said at the end of December when she announced it, like this is inconvenient for the unvaccinated by design. Right. Like they really are using all of this, at least by their own admission, to get more people vaccinated. But I like what you said, Clayton, about like this data that you're going to walk us through. You're not able to say, because people are pretty quick to jump to, well, this means the vaccine doesn't work. And it's like, no, we would need different kinds of data than we're looking at here in order to make that judgment. Really, we're just using this data to evaluate the claims that they're making about the percentages of vaccinated and unvaccinated that are getting infected and being hospitalized and dying. So go ahead, Clayton, walk us through just what you found with denominator gate. Man, that's a mouthful, but I like it.
Yeah. Okay, I will. So you got my presentation. So Just funny with Inspector Cobb, that's me, my last name. And so this will be a walkthrough for what I saw initially, where it led me, then why I got more interested in it, and then what I found, and now what the most recent results are as of yesterday, because that's when the most recent New York City Department of Health update was. So let's start here. It's funny because in preparation for this, creating this presentation, I saw this person right here, T Nerds, put this image up. There is just a thin line between a numerator and a denominator. That's pretty good.
That's good.
But I think it's a good entree because that's what this is all about. Even though I call it denominator gate, the numerator might be the bigger problem. And I'm going to get into exactly what I mean. But what we have here is a simple math lesson, right? And I know it's funny, people say all the time, oh man, you got all that math stuff and I can't keep track of whatever. It's like, well, I understand. I mean, because a lot of people don't want to deal with it after they get out of school, and it was a pain during school. But with a fraction, whenever you have a fraction, you have a numerator and a denominator, and the higher the denominator is, then the lower the result is going to be.
Mm-hmm.
And the lower the denominator is, the higher the result is going to be. Well, we have both issues with the vaccinated and unvaccinated data. The reason being is the denominator represents the size of each population. The vaccinated population is a denominator, and the unvaccinated population is a denominator. Then the numerator is, how many people had a case that were vaccinated, how many had a case that were unvaccinated.
Sure.
So all four of these affect the ratio and the outcomes. And what we're getting is the difference for this ratio versus this ratio is very high. But we're going to find that it's because the numerators and denominators all are skewing in the favor of vaccinated and away from unvaccinated, making unvaccinated look worse. So that's what I'm going to get into. But this is a really good, joke to start with, and it is true.
Yeah.
The thin line just between the two. All right.
Just super quick. Nobody told me that math was going to be involved today.
Sorry, Eric.
Math is fun.
So this is the first chart I saw. New York City, NYC Healthy, New York City Department of Health, has a pretty nice page of charts and data, and you can go there to find out like the vaccination rates for different age groups and ethnicities, and it's actually pretty useful. But then they have this trending area where they show vaccinated versus unvaccinated, and that could be useful, in my opinion. It's not my opinion. It is a useful thing, but it depends on how it gets used, and that's really the problem here. So there's a couple of details I want you guys to see. First, you can see that this is only through 12/19. So this is the reason why it's only through 12/19 is I wanted to historically preserve it because I can't go back and see it. Even if you try to do, in a web archive, the data is driven, it's data driven. So it presents based on the current data. It doesn't render just an image, right? It's actually rendering based on the current data that's behind it. So when you go to try to look at old versions of it, it doesn't work. So I took screenshots. And if you notice here, it's pretty crazy, right? The unvaccinated are shooting off the chart, literally, and vaccinated has somehow peaked before, the week before on 12/12. So the city as a whole was going up, unvaccinated was shooting into the stratosphere, and vaccinated was going down. And there were people that posted this, like Dr. Craig Spencer, who's a New York City, checkmark, doctor, ER doctor. And he's like, oh, wow, this is incredible. Look at the difference here, and please get vaccinated, that type of thing. And I looked at this, and you guys probably know, data well enough that even if that were true, that the difference was that much, it doesn't make sense that vaccinated peaked on 12/12. That was before Omicron even took off.
Right.
So and you know what? There's people like Zeynep and Cheese and others that said, they started speculating vaccinated, they might get infected almost as much, but then they clear it faster based on those studies that show, that they clear faster and their viral load is lower. And so then they're going to peak earlier. That makes sense. Like that was their first reaction. My first reaction was, no, this indicates a data problem. I mean, that's the first thing I thought of. I didn't think it's a conspiracy, but that didn't look right. And so I want to point out a couple other things because it's really important. Notice under hospitalizations where it's highlighted, you see that little the wording, it says hospitalizations per 100,000 people, appropriate, nothing wrong with that, although it depends on the population size.
Sure,
each, right? But then age adjusted. Okay, so those are two big issues that are not nefarious. One, you should do it per cohort size, right? Population adjust, but then the age adjustment, that's a problem because that is opaque. Like we can't see that formula. And though it does seem to make sense that you would age adjust, I'll explain why. The reason is, when we vaccinated, we on average vaccinated elderly first. So what you would normally see is sort of a linear reduction in vaccinated age groups. But that's not really the case anymore because in New York City, the middle ages, even the 13 to 17 age group is more vaccinated than 75-year-olds. Think about that. There's more unvaccinated 75-year-olds and above in New York City than there are all of 18 to 74 combined. It's actually 18 to 24 plus 35 to 74. There's a small group in there, 25 to 34, that has a bunch. But how is that? I mean, think about that. That many 75 and over unvaccinated, but yet you're age adjusting the other direction. I think you would age adjust towards the unvaccinated. Like that doesn't make sense when the most vulnerable are the most unvaccinated, unless the data's wrong. But anyway, I digress. There's so many things to get into. I just wanted you to see that.
I think it's a good point though, because we see that again, any time there should be, they want to make an assumption. The assumptions go only in one direction, right? You know what I mean? It's like, to your point, like if they were to make an assumption, it would make total sense, if you were being intellectually honest, to go the other direction. But once again, they want to scare people. They want the shots to work. They don't want in their words, a misconception about the shot. So they do this.
Yep. And frankly, the age adjustment, New York City's not doing something strange or on their own. They're using the 2000, it's the CDC 2000 population estimates. And what I mean by that is not how big the population was, but the breakdown of age group, the percentage of each age group. You see what I'm saying?
Yeah.
So it's not some big conspiracy. At first, when I saw it, I was like 2,000, but then I realized it's just a standard. So they picked this they made this document based on the 2000 age distribution, and they have these weight tables where are you doing 10-year groupings, 5-year groupings, 20-year group, whatever those groupings are, they give you these weights, and then you apply those weights to your own population in 2020 or 2019 or whatever, and it gives you this formula, I guess, but I don't know the formula, and I don't understand how they're using it, because you can't just weight the population from between 2000 and 2020. You have to weight the population that's vaccinated or not.
Right.
And if more of the 75 and older are unvaccinated, then you can't take the 5 to 11 unvaccinated and say, look, see, younger people are more unvaccinated. No, I mean, the ratio of hospitalization deaths between 75 versus 5 to 11 is astronomical.
Sure.
1,000 to 1, 10,000 to 1. So anyway, I just am saying that is not some crazy thing they're doing. And this is part of the theme that you're going to see in the presentation is the CDC does it too. And every other health org that I've been able to find the definitions, they do it too. This is a standard. It's the 2000 age population estimate, age adjustment standard. Okay, but I don't think you can apply that to every scenario. It depends on the vaccination distribution, in my opinion. But anyway, I saw those and I wanted to know what they meant, because that's how I do things, right? You can't just look at the numbers and say they're wrong. You have to go find the definition. So that's what I did. The next slide. Don't read the whole thing, but in the first one, you'll see about the third sentence, it says that the population estimates they're using are based on July 1 of 2019. Okay, and as you know, probably, the census is only every 10 years. Right? So this is 9 years away from the most recent census. They don't really know, they're called intercensal estimates, population estimates. But the reason New York City is using that one is because the 2020 census is available, but it takes, I guess, the government so long to break it down into demographics, age, ethnicity, that until New York City has the full breakdown, they aren't going to use any of the 2020 census denominators on any of their metrics. And I'll show you in writing where they say that. But that's why they're using it. But then I noticed the CDC is doing the same thing, and then the CDC says on their aggregate chart that all the data from all the jurisdictions is based on the 29 census. Now, why does that matter? Well, the reason why that matters is they know the vaccinated population because they have records of people getting vaccinated. So that denominator is pretty solid. But then they assume and guess the unvaccinated population by simply subtracting the vaccinated people from the population estimate they use.
Right.
So again, we're at a denominator issue. If that population estimate is from 2019 and is an intercensal, because so it's 9 years away from the most recent census, the one before it, then how far off is that? We know that population grows, and yeah, there's immigration in and immigration out. But what happened is the 2020 census for New York City jumped a huge amount.
Right.
And they know it, but they aren't using it because they don't have the demographic breakdown yet from, the US Census Bureau. So their denominator for unvaccinated is based on this lower number that is artificial from 2019, which only hurts unvaccinated.
Right.
Because it makes their denominator lower. But let me tell you another way it hurts unvaccinated. Think about how they determine how much of the population is vaccinated. What is that based on? The same 2019 denominator. So let's just do basic math. Let's say you have 8 out of 10 people, in your population vaccinated. That's 80%. What if it's actually 8 out of 11? Well, now it's down to 73%.
Right.
And that's a big jump. I mean, it's not that much of a difference. But just doing my math, if I just take the 2020 census, the New York vaccinated rate for fully vaccinated goes from 76% to 72%. Now that's 4 points. Is that important? I think it is. Why?
It is.
Because when they're doing the vaccine effectiveness, VE, they're basing it on how much the population is vaccinated and then how much the unvaccinated outcomes are. Once you drop that 4 points, I mean, that changes the whole, it's a whole numerator denominator issue. But
they base a lot on that.
Right. So the next thing is, in the bottom summary, I've highlighted the part you need to see. For their breakthroughs data that I evaluate, look at the definition for unvaccinated.
No record.
One, it's only 5 and over, so they're not counting all those under 5. And no record of vaccination site. It doesn't say who we know are unvaccinated, because how can you know that? Like, let's think about that. Can you really know how many unvaccinated? You could never actually know. I mean, is there any scientific way to check?
Nope.
So we're only basing it on public data records from, in New York City's case, 4 different databases, 3 of which are from New York, 1 of which is from New Jersey, where they cross-reference every case, hospitalization, and death against those vaccination databases to find a perfect match, at which point that is a vaccinated outcome. Until such time, or if it never is found, or if there's any issue or clerical error, it's still unvaccinated. So that's why I've started calling unvaccinated here unverified.
Yeah, and just to interject here for a second, for anybody who's watching or listening that's from Chicago, very recently, I think it was actually this week, I haven't tweeted about it yet, but the city of Chicago finally defined unvaccinated, and it's in their data, and it's similar, Clayton. They say that unvaccinated is no evidence of having received a dose of an FDA authorized or approved vaccine prior to a positive test, which really just means, yeah, you're unverified, right? Like, but when people hear unvaccinated, they think it's people that we know have chosen, or it's been verified that they've chosen not to get any doses of the vaccine yet, right? Like that's what what people assume, but that's not what unvaccinated means.
Well, and also like like if you have any exposure to the kind of record keeping that takes place, and again, not saying it's nefarious or necessarily on purpose, but it's sloppy.
Yeah.
Right. Like, I mean,
sloppy.
So what kind of people, what kind of situations, for example, could lead somebody to be, in their terms, unvaccinated, in your terms, unverified? Like, if they go ahead.
I have some. I didn't know. I was kind of scrolling through to see if I had a slide on that, but so there's several things, and I didn't just make this up. I actually got it from the Massachusetts Department of Health, who in their breakthrough summary, their first page has a disclaimer saying, here's all the reasons why vaccinated outcomes may be undercounted and the unvaccinated may be overcounted. And they say
accidental honesty.
Yeah, they actually just flat out say it. They say first is the systems for tracking cases and for vaccines are separate. So it's always a cross-reference. And they admitted that even just basic clerical errors can cause a mismatch. The spelling of a name, date of birth, address, they could be omitted or they could be mismatched. Like my town in New York, I don't know if you guys know this. I don't know how it is in other places. I didn't know this till I moved here, but you're in a city, then you're in a town, then you're in a hamlet.
Oh yeah.
And I live in a town that I'm in a town that I don't live in. My address is the town next to it, but I don't live in that town. So it matters. Like when I go to the train station, if I park at the train station not in my town and I don't have the sticker, I get fined. But that's my address. So I have the address of the town that I don't actually technically live in. And then my hamlet is a different name, which is what I typically use, but you would never find that on like a regular map. So even little things like that could potentially cause a difference between a match, right? Because there's people with the same name. Maybe, and is this left to humans? Does a human go, I think that's Clayton from Northport, but is Fort Salonga the same? Well, is that, I don't know. Does someone make that judgment call? Or does a computer do it? And if an algorithm does it, are they putting in errors to say, error matching where that's close enough, it's within 5 miles of the zip code? And then, but if you did that, then you're definitely going to have people whose names overlap and get mismatched. I mean, they say that, and then they also say that hospitalizations for vaccinated are likely an undercount because they're completely based on case investigators at hospitals interviewing patients.
Yep.
How many are incapacitated? How many claim they are but don't have the record of it? What happens? Do they say, well, I don't see your vaccine card, so I have to count you as unvaccinated? Or, oh, you only have record of 1 dose, not 2, so you're partially vaccinated? Look, any of that, I mean, it's not just 1 or 2, right? This is substantial, and they're not even telling us, hey, there's a potential for a 15% error here, right? They just act like it's clean as a whistle.
Well, and am I right that in New York City's data, like in Chicago's data, that a COVID hospitalization is not necessarily somebody who's been hospitalized for COVID, but somebody who's in the hospital for whatever reason, and at some point, either upon admission or at some point during their stay, has tested positive for COVID, right? Like, isn't that what it means in this data set? Am I right about that?
Well, they don't
They
define
don't say. Okay.
hospitalization, but it's probably, I mean, they don't differentiate between with and from.
That's
So,
what I mean. Yeah.
but I don't know if that hurts vaccinated or unvaccinated. You know what I'm saying? Like, I don't know if that
No,
makes
I
a
don't
difference.
know.
Yeah.
It's just it's still disingenuous because when people think COVID hospitalization, and we've known that this isn't the case for a while among the three of us, but they think, oh
Yep.
my gosh, somebody in the hospital, because of COVID, because they have COVID and then they're hospitalized and they're being treated for COVID and they otherwise wouldn't be in the hospital. Do you see what I'm saying? Like that is still what people think, and that's not what that term
Yeah.
means
Yep.
at all. So
And they write it too.
oh,
You know,
yeah.
once again, they lean into that. They're okay with that misconception being out there, which is
Right.
problematic.
Right.
Well, guys, this is why it's so hard to write the article and do Twitter threads. Is look how much time I've taken. I've gone like 2 slides out of 30.
I feel your
absolutely
pain.
riveting. I mean, but it's so deep, it's so in the weeds, but it's so important because this is the stuff that they base this policy on. To your point before, Adams says, I'm doing what the health professionals are telling me to do, and then the blue check health professionals are looking at that first chart that you showed, but nobody's scratching
globally.
Yes, and nobody's scratching beneath the surface. And I'll have to dig it up for the next show. But early on, there was a super quick aside here. Michael Levitt did an interview with some other Nobel laureates, and he was livid on this thing. It was wonderful to watch him because he was very angry. And what he kept saying, this was like in April of 2020, and he kept saying, like, I keep asking people to check my numbers. I might be wrong, but I keep doing these numbers and nobody will check them. I get canceled. I get, unfriended, and just check my numbers. And that's what you're doing here. And that's one of the main mistakes that we've made all along, in my opinion.
Yeah. Yeah, for sure.
Yep. I'm with you. And that's kind of where I am. And unfortunately, I have nobody that can make a difference checking my numbers, except, Blaze looked at it and did an article, but I can't get anyone that is either on the other side of the fence or at least sort of respected in the middle of all this. Like even David Leonhardt, like I think he's still way, on Team Apocalypse, whereas Team Apocalypse looks at him as, ridiculous, like he's a traitor. So someone that at least is willing to just have that discussion, but I can't get his attention, right? He's a big New York Times guy. I'm just a random nobody. And if he would sit down with me and go through this, we could have this type of conversation. Can you imagine? Like he would be able to understand it and go, wow, I mean, let me go find out. Because if he could go ask these questions to Department of Health, it would blow it open.
Sure.
Because then they would have to be more careful about this and be more honest about it. I shouldn't say be more honest. I don't know that they're being dishonest. They just may not even know this is happening. I think the data people at the ground level do, and I'll show you some of the quotes, but I don't think the mid-level and upper-level management, and definitely not the commissioner Choksi. I don't think he knows this stuff at all. So, but I would like to show, I want to run through this a little bit faster so that I can get you guys through it, and I'll try not to commentate too much. But look at these three. Let's go in order. Let's go to the first one. The first one is a response on GitHub when I submitted an issue, and this is from one of the data team members, and I don't want to put the name specifically. I don't want to get people going after or whatever, but I mean, she was just responding honestly, and this is great. But read the part that's highlighted. Cases that don't match to a vaccination record are classified as unvaccinated. That's what we figured, but good to have it in writing, including unknowns. Now she put that because my question was like, what about unknowns? Like, what about ones you're not sure about? And so she was putting it in quote, like to answer my question. I don't want to make it sound like she just offered that out of the blue. But this was me getting in writing from someone on that team that this is how it works. So, and I kind of left it at that. The next quote is from the same person when I asked about population. And look what she says. They're waiting to update it until this 2020 census is ready. And look what she says about New York City's population. It grew substantially. And that does mean that it affects the unvaccinated denominator.
And they know it.
And they know it. And it inflates the vaccinated population number, the percentage of population vaccinated. So this third quote is a little bit off from the other two, but I just wanted you to see it was another data team member. And I highlighted the part that's important because it gave me insight into the mindset of the people that are doing this, that are collecting and displaying the data. Do you see the quote down there?
Yep.
In his opinion, the fact that that New York City chart was off, the unvaccinated was off the chart in the stratosphere, was consistent with other areas in saying that case rates are dramatically higher among unvaccinated people. That's case rates, which we know that's not true, right? It may not even, we see negative in the UK, but who also has their own denominator gate issue in the other direction, right? There's an argument over them including too many people that don't live in the country anymore. So I don't get too crazy about their case rates being negative, but Denmark shows virtually zero, 1-to-1 ratios. So why does he think that it's consistent, that there's a dramatic difference? And if he firmly believes that, then how does that affect his ability to honestly assess the data and what's going out onto the website and briefing upper management? Does that make sense?
No.
Well, but does it make sense that it's a worry? Like that's a
Right.
concern.
Yes.
If the base, the engineer level data people believe this, like that's a belief. That means they don't know data from other jurisdictions, and the people they do talk to are all convincing themselves this is normal.
Right.
So,
do you know why?
It's a bubble. Why, it's evidence of a data bubble.
Yep.
Why? Data echo chamber. So why, Clayton? Could you just explain, why not just report the raw number of cases or the raw number of deaths and just say, hey, here's the percentage or number of deaths that were among, people who with no doses, people with 1 dose, people with 2 dose, people who are boosted. Do you see what I'm saying? And just do the percentages. Is rates more honest, less honest? Do you see what I mean? Do you think rates are used to kind of confuse the issue? Because I can see a rationale for rates, but at the same time, we've been given raw numbers this entire time, right? So in Illinois, this is how many COVID deaths there were today, right? Isn't the bottom line that people would really want to know, okay, there were 50 COVID deaths in Illinois this past week. How many were people who were fully vaccinated? Right?
Okay, it's a great question. First, I'll do devil's advocate for why it would not be appropriate to do raw breakdown. The reason it would not be is because of the base rate fallacy, which as more people are vaccinated and the higher percentage of the population is vaccinated, it is not fair to show, say, a 50-50 split of outcomes of cases or deaths or whatever, because in reality, that's from, the vaccinated pool is much larger and the unvaccinated pool is much smaller. However, that's why you wouldn't only give that data. If you just gave that data, that would be misleading or maybe even dishonest. And I get hit all the time by people that are trolling me saying that's what I'm doing when I don't do that. I do give both. I give rates. I've been doing hospitalization per million. You know my charts comparing states. How often have I done that? Do I ever show 2 states like Florida versus Vermont or, where they're completely different sizes and put the raw? No, I always do rates. But the moment someone here's the reason why you should give the raw in addition to the rates, is because there are so many check marks and so many media personalities and so many doctors out there that don't know data who say things like the vast majority of people in the hospital are unvaccinated. The vast majority of deaths, 95%, are unvaccinated. And then I'll go, I'll facepalm a little bit. Then I'll show them. I was like, no, look at the last week in New York. 387 deaths were vaccinated, 340 were unvaccinated. And then I'll even say, hey, the rate is still better for vaccinated, but what you said is completely false. And then I'll get 5 replies of, oh no, there's a base rate fallacy here. Look at this little picture where, and I'm like, that wasn't the point. The point was this person said the absolute number of unvaccinated was 95 times higher, or 20 times higher. And I responded to that. And they just, it's like they can't allow any nuance. They can't allow any reasonableness. So what happens in the UK is they give both. They show the breakdown of cases, hospitalizations, and deaths for no doses, 1 dose, 2 dose, and 3 dose. Then they give the rates per population, which is amazing, right? Because based on that, we can tell, look, the vast majority of deaths are actually vaccinated, but the ratio is still preferential to those vaccinated in terms of the risk. That's great. The difference is, though, the rates are 2x, 3x, 4x. Sometimes it gets up to 6x depending on the week. But I think New York City should be doing that. But I can see how people that want to, look, New York City has a vaccine mandate, which we already know does nothing to help. It may coerce people into getting more vaccinations, but it doesn't change the trajectory of the virus.
Right.
So if you think about it, the people that are willing to do something that authoritarian and not scientifically backed, how likely are they to be honest and fair about data presentation? So your question was great, Jessica. There's a reason why you would not only give raw, but there is a reason to give both.
Sure.
And the other reason to give both is when you see the raw and people realize, oh, vaccinated people do die and they do get in the hospital, actually in quite high numbers, then you know what we need after that, Jessica? Is not just the breakdown of raw, vaccinated, unvaccinated, but by age, like UK does.
Sure.
New York City won't do it. I've even asked for it, and they just flat out said, we do not publish that data. They didn't say we don't have it. They said, we do not publish that data, those data. And if they did, we could show, well, look where it's all happening. It's unvaccinated 60 to 80-year-olds or something like that. If that were the case, then put your marketing towards them.
Sure.
And don't force them, but
unverified.
Yeah, unverified. Yeah. Well, and I mean, this is like a whole other, this is a whole other can of worms, but, we still eventually need to get a handle on what a COVID death is, right? Like we still have many jurisdictions. I just posted something about Illinois, Hancock County, like from their public health department last week at a meeting. Like they were pretty honest in their meeting notes. They're like, yeah, somebody dies of cancer, but they tested positive for COVID within the last 2 months. Like that's a COVID death. I mean, so that's an issue, right? Like that is still that's still an issue for me that I hope someday gets resolved.
Well, but there's also these incentives to do that. And again, they all come from, I think, arguably a good place, right? But we put people out of business. We, closed up entire hospital networks and medical facilities. And then you had to sort of, backfill that with, federal trillions of dollars. And in order to get your federal trillions, you had to claim COVID. And there's all these monetary incentives, again, with great intentions, I'm assuming, but they all have these very, very unhelpful negative externalities. And one of the main ones, for the last almost 2 years now is you do get, various amounts of recuperation for something being labeled COVID, even, from an admission to event down to a funeral, right? If you can get somebody to write the word COVID on that line, there's money involved.
$9,000.
Yeah, I think the figure for event was like you get 40,000 extra. And I think that not to short circuit to your overall theme here, Clay, and I think you mentioned this at the beginning, but it really does. All of this really does go back to honesty being really the best policy, right? If you want to incentive transparency and honesty, absolutely, right? Like all this stuff that we're talking about are these fudges that they're making. Again, maybe with the best of intentions. I'm willing to assume that. But they do this in order to achieve a goal, in order to make people do what they want them to do. And it always backfires. It always creates more problems than it solves.
Yeah. Eric, you're like the plant in the audience with this slide. Wait till you see what it's about. This is perfect. I'm so glad you said that. This is a bigger exchange here because I wanted you to see the progress, because it's hard for me to put all this out in public because it's just so much information and so many conversations. This is the tail end of a thread, an issue that I submitted in GitHub, trying to get them to change the population or to explain when. And they showed me the schedule. Actually, there is a schedule for the 2020 census when the US Census Bureau will put out certain things. They said, see, we can't update our database for ethnicities and age because look at the dates. It's like March 2022, then July 2022. Then they're really far out dates for when they get those pieces of data finished for the 2020 census. But they have finished the overall population and the New York City population. So I wrote at the very top, we know that the 2019 intercensal is around 500,000 lower than the 2020 census. So can't you just take that overarching population and change the denominators on these two things?
Right.
And look at her answer. What's the answer? I mean, they're not going to do that because they want to use a consistent estimate for all metrics. So instead of doing the best they can to change the ones that they know they can change with accurate information, they choose to keep the inaccurate denominator,
right?
Because they want to stay consistent with all the other calculations. Now, I can kind of understand the desire to be consistent, but not when the result of it is two lies
Yes.
that
Right.
are affecting
Right.
public policy and
Right.
the livelihoods of 65% of 5 to 11-year-olds in New York City who are not vaccinated.
Well, that's the key, isn't it? Right? It's like some of these data issues wouldn't be so infuriating, although they should, all data is limited, right? And so those limitations and qualifications need to be clearly explicated for people. But what's happening is not only are all those limitations not being fully explicated, but when it comes to media reporting things, they're just taking scary graph, right? And scary numbers. And those are the things that are keeping 5-year-olds that haven't gotten the vaccine out of New York City restaurants.
And who were recently infected with a mild cold
Right.
and have the highest level of immunity that you can get, essentially.
Absolutely. And just super quick, do we think that if the situation was reversed, that they would do this? Meaning, if the current way they were doing it, right, by using the consistent population estimates, happened to show that it was, that being vaccinated increased your chances of, going to the hospital. I'm just throwing this out there, but if it sort of showed the opposite story of what they want to portray, I would say
they would take the extra effort to clarify it. They would either change it where they can or put a bunch of headlines or red alerts saying, by the way, this is underestimating probably by this much, but they wouldn't be able to explain that. It would take too long to explain to someone on a website with a footnote or a header. So they would just show the more realistic numbers.
Yep.
I believe that. And again, but the problem is we're getting into motive a little bit. Like, you can't speculate what someone would do in another scenario, but it does seem likely that they would do whatever.
Well, they've been very
vaccine rates the most favorable look, especially if it's with the more realistic data. That would make sense. I would want them to do that, but they won't do it when it hurts, when it helps the unvaccinated.
And they've announced that, that really essentially is their, I wouldn't say policy, but that's their intention.
Yep.
Right.
Yeah. But let me keep going. I want you to see the quote at the bottom, and I highlighted the part. This is Commissioner Chokshi of the New York City Department of Health from September. He said that they want to make sure they want to be transparent. They're one of the most transparent in the world. But look at the two things that they make sure of before they release data. The first is that it's scientifically valid. Okay, I don't know what that means exactly, but I wish they would just give it. You don't have to validate it. Just make sure you give what you have. But look at the part I highlighted. They first make sure the data is connected to a public health purpose.
Right.
Didn't you just say that? Wouldn't they be more aggressive about adjusting it if using the wrong denominator hurt their numbers? I don't know. To put this, to actually say this and have it put in writing is tough, right? He's clearly, just like the CDC MWRs, right, where they
That's exactly right.
only publish things that support the CDC policy.
This is where the entire concept of public health doing this comes into question.
Yep. So let me say one thing about population denominators for New York State and New York City. This is important, and even the U.S. 2019 intercental estimate is the furthest away from the 2010 census and is a guess. The 2020 census is supposed to be a refresh. Okay, forget those. Now here is a much better look at where we are. But then things still change from 2020 to 2022, right? Now, you probably all saw, we are the type that would highlight the fact that there's been an exfiltration, right? People have been leaving Illinois, New York to go to Florida, Texas, Arizona, right? So from when COVID started, you guys have seen it, right? There's been reports of, this negative number from the Northeast, this positive number in the South. Have you guys seen those?
Oh yeah,
absolutely.
Sure.
Okay. So wouldn't that stand to reason that there is some reduction in the New York City population from the 2020 census?
Maybe.
Is that that's reasonable?
I would probably assume that, yeah.
And there's an article which I had known that said, there was 300,000 people left New York State. Now I don't know how much for New York City because it doesn't say, but it's 300,000 for New York State, and that's reasonable, right? So maybe if she says 2020 was higher, but what if 2021 is 200,000 lower? Well, I'm okay with splitting the difference or calculating both because it's 500,000 plus for the 2020. If it's 150,000 less for 2021, then where does that leave us? Plus 350,000. Let's use that. I mean, I'm okay with that.
Or use
But
both.
29, you can
Right?
show
Or
both. If
Sure.
this is
present
the
Right.
both
population.
Right.
and just make it very clear
Right.
what one's
Yeah.
doing and what the other's
But
not.
using the one that is clearly lower and clearly wrong is my problem. And that's what's happening for
Agreed.
the entire data set in the CDC's data set. And though the US didn't have much population growth during COVID, compared to normal, I found a DHS study from like 2018 where they determined that there were, and these are their terms, at least 10.8 million unauthorized migrants, that was the term they used, that were not counted in the census. At least. Now, I'm not here to I don't get into immigration and things like that. All I'm worried about is what's the proper denominator.
Yeah, they would, that would affect a denominator for sure.
You can't ignore that, right? And especially if the entirety of that issue goes to it hurts the unvax, because it doesn't hurt vax. Funny thing is, there's probably a bunch of that 10.8 million who are vaccinated and count in the numerator for vaccinated,
Right.
or in the denominator, but not counting in the denominator for the unvaccinated side. So you see, it hits us in every direction to not have accurate data. And the moment I mention unauthorized migrants straight from the DHS report in 2018, people go, oh, now he's trying to say, it's illegal immigrants. I'm like, no, like, come on. Can we, like, not everything is political and partisan. I'm not here to talk about the building a wall and immigration, right? This is about numbers, and you have to be honest. Right. I didn't even know personally that undocumented, migrants were counted in the census at all. Like, I didn't know how much. Was it a lot? Is it all? Is it less? I didn't know. What I learned was they are part of the census, or they're supposed to be, but that DHS estimated there's around 10.8 million missing, that are unknown or unaccounted for, and that was in 2018. And
well, there was a kerfuffle about that. Trump actually wanted to not count them. He tried to change the census form, and it actually went to SCOTUS, and they said that you have to keep the same census form that the Obama administration had come up with.
And I don't have any commentary on that. All I have is it's a thing. And is the population of the U.S. 328 million, or is it 343 million or 350 million? Right. That makes a huge difference, because whatever that gap is from the 2019, or by the way, the 2019 intercensal for the U.S. says 328 million. Will someone tell me what the actual legitimate, realistic population is today? Is it 328 million like the 2019 is, or is it some number above that? Well, whatever number it is above that, that gap hurts the unvaccinated. That's it.
Right.
So I estimated 5% difference, not that there was 5% growth since 2019, just that the current number is 5% higher than the 2019 intercensal. I want to make sure that makes sense. Does that make sense to you, Eric? That I don't claim there was a 5% growth, just that there's 5% more population than the number that was estimated in the intercensal for 2019.
Yep.
That's my rough estimate based on the DHS thing and sort of minor growth since then in the US. So it could be 3, it could be 2, could be 4, could be 8, but whatever it is, it's more than 0, and that hurts the unvaccinated. Okay, so.
Yep. But that's connected to their public health purpose, which is really just getting people vaccinated, right? According to Mr. Choksi. I mean, that's really what he's saying there. Like, oh, scientifically valid, and then the data is connected to what we want to push on people, right? I mean,
well, and ultimately they are reaching those people and they are vaccinating them. They just don't show up in the unvaccinated denominator.
Right.
So anyway, that's all I'm trying to get at is, if I sat down with some people that were honest about it in government and said, what is a true, valid, reasonable, realistic accounting for the population of New York City and the population of the US, and I didn't tell them what I thought it was or how I got to that number, and they told me, and I said, well, what about this? What about that? And they go, oh yeah, you're right, blah, here's the number. I would take that number and put it into the calculation. That's all I would do personally.
Sure. Right.
But they don't. Right. They take the lowest one it can be, unless you're going to tell me that New York City has shrunk since that low estimate in 2019, or the US has, then it hurts unvaccinated. Oh, and one other thing, I don't have it in the slides, but here's another reason I know New York City is undercounted heavily. Do you know they have 3 major demographics with negative unvaccinated?
Which demographic?
Negative. Asian, they're at 108% vaccinated. But they don't show that on the website. They show 99 with an asterisk. But when you go get the data, it's 108%. So there's like negative 20,000 Asians, Asian and Hawaiian Native Pacific Islander. That's the group.
Yeah.
There are 102% of 18 to 24-year-olds. So there's no one 18 to 24 unvaccinated, and there's negative like 10,000 walking around that are unvaccinated.
That's impossible.
Exactly. And 35 to 44 crossed over the 100% threshold last week. So they're at like 100.8, 101. Do you know that the Native American and Alaska Native is up to 133%?
Wow, impressive.
Good.
Impressive.
For them.
They're all
So,
in. They're all in.
Holy crap.
And there's a couple others that are getting in the high 99s, right? It's just not possible.
But it makes their vaccination efforts look good, right? I mean,
that's all they care about,
right? Like, hey,
they know it. They know it. They put it a disclaimer saying,
somebody put the asterisk there.
They put it. They even say in the notes that because we're using this population, some will go over 100%. We cap it at 99. But this is bound to happen when you use an older population estimate. That's what the New York City says. You know what CDC says? This is crazy. It's on the website. They say that they cap all vaccination rates for all the data that comes in at 95% because they assume that there's always at least 5% of every demographic unvaccinated.
Sure. Right.
Well, how can we get to COVID zero if that's true?
Yeah. But think about how profound that is. That means they have data coming in from the jurisdictions that they know is wrong, and they're building a 5% buffer, and that is the best you could ever get for the unvaccinated side of that equation.
Sure.
Because once it gets up there, you'll never get better, right? But I guess you won't get worse.
Sure, right.
But it's not feasible to think that 95% of so many jurisdictions are vaccinated, and when they know, and it keeps going up to 97, 98, 99, 100, 102, all that does is tell you that the data is completely wrong. It tells you it's wrong, but then they still display the data. And I'm about to start showing the data that got displayed, but I know we took so long on this. It takes a lot to explain.
It's good. Weeds are a good place to be.
Well, and just as a quick thing, I mean, this is a note. I'm going to put it in the chat. I hope it all fits. But this is from Chicago's data. They're now getting more and more specific, I think, because there's been pressure about what their terminology means and kind of what populations they're using. But they say too, overall age-adjusted incident rates are standardized using the 2000 census standard population. So that kind of speaks to what you were talking about earlier with what New York is doing, right? So I don't think there's any reason to believe, I bring that up because I don't think there's any reason to believe that New York City is the only one where this is happening, right? I think if it's happening in New York City, it's happening in Chicago, it's like a standard protocol that they're all following,
that's how I understand
right?
it.
Right. It's not some guide, some data expert guy at a desk in New York City kind of making these decisions on his own. Right. That's not what's happening. It's standardized in some way. Right.
That's what I found. And the more I looked around, I kept seeing the same exact language, the same age adjustment standard, and the same 2019 intercensile. I never even heard that.
That's
word,
interesting.
But it's basically a standard.
Do we know where that wells forth from?
I don't, but I assume the CDC, because they're the ones that created the standard. It's a CDC document that I have a link to that I put out all the time on Twitter. So they probably set that standard and just advise all the state departments of health and county departments of health, this is the way to come to your conclusions.
Maybe a dumb question, but do they post something on their website and the local health authorities go to the website and sort of pull that same language? Or is there more sort of a directed, direct line of communication where they hand out this guidance specifically to
I couldn't know that. All I know is that the language is so cut and paste that it seems like it's just the memo. Like there's a guide and they follow it.
We should foil that.
Yeah, we should. That's what I was going to say. We could probably get it. It'd be easy, right?
But is it even an issue? Because I would expect that. I mean, that's the expectation.
Right. No, I would just want to see what the guidelines were. I would just want to see what the original. It's like source material. I don't know.
But I think though that what that does is if you're sort of blindly just following orders, that's not really helpful, right? You'd want somebody like a locale that has been dictated to by the CDC to use this verbiage, to do it this way, to blah, blah, blah. Somebody, like a Clay that happens to work there, be like, this doesn't seem right. Why are we doing this? Or maybe we're going to try something else, which is what I think Florida did, right?
Right.
Well, and by the way, I did ask that question about age adjustment to the same people that you saw these other quotes from, and I got a canned answer of, well, pathogens hit different populations in different ways at different times, and it is important to adjust for the percentage of population that is vaccinated or versus those that are not, and for that reason we use the 2000 age adjustment standard. And I was kind of like, it was just like on Twitter when I answer someone with an absolute number, they make an absolute claim, I give an absolute response, and then someone says, base rate fallacy. It was like the guy didn't read anything I wrote. Because I said, I know that you're using the 2000 age adjustment standard, and I know the CDC says to do that, and I know everyone else is doing that. What I don't understand is, how does that apply when you have more 75 and older unvaccinated than any other demographic?
Sure.
And he goes, we use this standard, and that's what everybody uses. Thank you. Goodbye. Close the ticket.
Right.
So yeah, they're not curious, and they think I'm stupid, I think, and maybe I am, but these are
they know you're right. They know you're right.
It might, yeah.
Yeah, they don't like being called out. That's one thing that I've really noticed in the last 2 years. Like the public officials, like, man, they're the experts, and you have no reason to question their authorities.
Well, and here we go. Another lead in. Thank you, Eric.
Exactly.
This is an example. Zeynep Tufekci, I don't know if that's how you say the name, but she's a well-known, I think she is a science communicator, not a scientist.
She blocked me either way. She blocked
communicator with over 100,000 followers and New York Times bylines and that sort of thing. I've interacted. She hasn't blocked me because I do challenge her, and I try, but I interact, and she will.
You're very polite, by the way, Clay.
Super polite.
You're insanely polite, like amazingly so.
Mm-hmm.
But it was this tweet, which she's not the only one. I don't want to target her because she's not the only one that did this. In fact, a ton of people did it. In fact, you can see she was just quote tweeting Dr. Spencer, the one I mentioned earlier. But I mentioned Zeynep because she will reply to me and then sometimes give up a little information that I need, such as why she is dismissing my argument, right? And it's good to hear it because then you get to see into the mindset of her and her colleagues. So this wasn't anything to do with me. I just noticed it. If you look at the date, January 22nd, and I know the images look blurry, but you can see it's the next like week or two later after the earlier one that I showed. It's no longer going to the stratosphere, but it's capping off, and you can see orange is so much lower. It's almost non-existent at the bottom. But the unvaccinated is way up at the top. Funny thing is, I know it's really hard to see down there, but the orange peak has moved. Remember when it was 1218 or 1211 or something, and it didn't look right? Well, now it has moved, but nobody noticed that. She didn't mention it. No one else mentioned it. Dr. Spencer didn't mention it. No one noticed that the one that they had shown a couple of weeks ago was artificial, and that it has actually converged. That date, the numbers have converged, and the lines got closer because all they're looking at is the most recent one. The recent dates, which are in gray. Why are they in gray?
Right.
Because it says these data are not complete, which some people call it out and say, look, I know that the last two are not complete, but look where it's headed. This is amazing. What they don't know is that not being complete means it's about to converge dramatically.
Mm-hmm.
They just think, it's just the data's not all in. What they also don't realize is it doesn't just converge for the last 2 weeks. It converges all the way back 8 weeks continuously. Like I'm still seeing updates for 1218 in yesterday's. And the updates get lesser and lesser, right? It's like a asymptote, right? It goes down to zero,
Mm-hmm.
but there's still not dramatic, tangible changes 7 weeks out, 8 weeks out. So that 2 week gray area is not sufficient. But when she did this, I noticed it, and just look at the wording. Understating how effective vaccines are. Like the normal commentary is understating their effectiveness. Why? Because look at this. And the outcomes are still this lopsided because vaccinated are protected so much better. That's what she's communicating. She's a science communicator, and without any scrutiny or critical thought or investigation, that's how she looks at this. The same way Dr. Spencer does. He just says, look, they speak for themselves. Absolutely stunning. Cheese, mac and cheese, she did the same thing. She's like, the data speaks for itself. And I said, no, they do not speak for themselves. Here, let me show you. So when she did this, I replied, and I'll show you. I should have done this first. These are the charts that are on Dr. Spencer's tweet. I just want you to see them more clearly. You can see how far apart the purple and the orange are. So purple is unvaccinated, orange is vaccinated, and cases are the best looking one. It looks like it's almost 7 or 8 to 1 or 10 to 1, But you go over to hospitalizations and deaths, you know, look at that hospitalization line for vaccinated. It's like non-existent. It's so low. So you're like 800 to 20 here or something. It's like a 30x difference. All right. Well, I come back and say, Zaina, please, will you take a serious look and report fairly? These are, and because I showed her some of the changes that happen over time, she says, oh,
Right.
minor adjustments are bound to happen. And I said, no, these are not minor, they're huge. And the real VE is not 15x to 97x. And I made a plea with her to just like, hey, will you look at this with me? Like, you're the one that people will listen to, and you're lean more towards the Kool-Aid. If you will be honest and look at this with me, I could explain it, and you would see that there is a problem here, and that it's okay to promote 3 to 5x. It's okay. That's fantastic.
Sure.
3 to 5x is fine.
Sure.
But don't gaslight people and fool them into thinking 15, 30, 97x is okay. Actually, you see her tweet at the bottom that I'm quote tweeting. She says, yes, minor adjustments happen, but when you make those adjustments, it doesn't change the underlying outcome. And I don't know, maybe she's referring to anti-vaxxers or whatever, you know, going all the way to negative. I'm not. I'm just trying to say you're promoting things that are not remotely believable and treating it like it's absolute fact.
Right.
So I had shown her some data, but I couldn't show her that the date. I'm going to go back up. These dates had not updated yet. Like, so they had given out the initial release of data, which is always skewed towards unvax looking the worst possible because they haven't done the vaccine record matching yet all the way. But I couldn't show that these dates in gray had moved up until New York City Health updated the data. They were supposed to do it last week, but they didn't. So I've been reporting all week that on the day that it was supposed to update, a week ago Thursday, nothing happened. And then on the website, you see the warning in the middle. It says, oh, sorry, we apologize for the delay. Please check back soon. They just say it's technical issues. And on the bottom image, I asked, and they never answered me. So eventually they answered yesterday, but only after they updated the data. So they went a whole week not answering or giving any clues. And then they, a week later, updated the data, and then they just said, oh, thank you for your interest. We have now updated the data. Bye, close the ticket. I mean, it's kind of like, I don't know.
So
what the
were you the
conversations are.
technical issue? What was the technical issue? Your
They never
inquiries?
gave an answer. Yeah, yeah, I might
That's
have
what
been.
I want to know. Did you, if you go back to that other slide with the graphs on it now, the one before it. So have you taken screenshots of every week that they post these graphs?
Not every week, but some key weeks, like when people are promoting it online and saying, look at it. You know, I usually
because
go
you
grab
don't
them.
you start to see even on their own graphs the convergence and the revisions, or
You
no?
do.
Okay.
You do.
Yeah.
Yes.
I mean, they might be zooming in and out, right? That's the other trick sometimes that happens. You know?
I'm gonna hit that. I'm
Okay.
gonna hit that, Jessica.
Yeah.
Is
Yeah.
if they would keep this scale and then show it, it would be super obvious, but they don't. They
But they don't.
rescale every time.
Yeah.
So then the shape still looks like you, unless you look at the math, the numbers and do the math yourself, you don't actually know how much
Yeah.
of a difference it is, even if
Yeah.
it dropped by, you know, a third or a half or 2/3 or whatever.
Yeah.
Okay,
Yeah.
so let me go to this.
So this is the raw, right? This is the raw data that I was talking about earlier.
This is
correct?
raw.
Okay.
And let me acclimate everybody's eyes because I know there's a lot of text on here. This is just 3 bars representing 3 different dates. The first bar is the original release of data. Now, this is week of 1/8. Do you see at the very top of the chart title? It says the week of 1/8. And I'm going to go back to the week of 1/8 in this chart up here. Do you see in the bottom there's a timeline? Do you see that the 1/9, that's basically the week of 1/8? Do you see how high the peaks are?
Right.
Or like, you know,
Yep.
Well, that's why this bar is gray, by the way.
Sure.
Because they know
Right.
that it's wrong, but they don't explain what that means or how dramatically different it's going to be. So we're looking at the 1/9 data point here. And this is just cases. I have all 3, but I'll show cases first. Now, the first week it came out, look how many vax cases there were, 56,800. But look at the unvax case, 188,000. They tried to tell us on the initial release in the chart that the ratio, and they don't even show it this way. They don't show raw. They take this, divide by 100K, then age adjust it. Just, it's like continuously multiplies. But right here, what, 56 and 188 is like 240, so it's like 50 out of 250. It's basically 20% of the cases were vaccinated. And then a couple weeks later, on February 10th, it moved about 40,000. Do you see how vaccinated went up 42, unvax went down 30? Well, but I knew that wasn't the end because the prior week, 1/1 had jumped all the way up to where over 50% of everything was vaccinated. It would not make sense for it to shoot up and then come back down. And I have a graph showing that it still was doing this, right?
Right.
So I made a prediction. My prediction is at the bottom. I predicted that they would come back on 2/17 last week, which they never released it until yesterday, but
Technical issues.
It would flip to being around 60. This right here would be 62 to 63% vaccinated.
Yeah.
Now, look how much of a change that would be from the original. That's plus 100,000 vax, minus 83,000 unvax. Gigantic, massive.
Huge. Yep.
Okay. Now let's look at I'm not going to explain now that you know what you're looking at. You can see my prediction at the bottom, right? You see how the blue line moves further and further right?
Yep.
I'd also like to point out the raw numbers. Notice that the raw numbers in all of these, I say vax will go higher than unvax. So I'll go back to cases. I say it goes up by 52,000. Here I say it's up by like 400. And then deaths, look at the original deaths, 100 to 300. That's 25%, 25-75. Then my prediction, I say it's going to be a little bit more vax, more like a 52% or something like 53%. All right. Well, now let's look at the outcomes. You ready?
Yep, I'm ready. Yep,
So
I'm excited.
I'm excited. A chart that has a fourth bar showing the outcome below my prediction. All right. Here's cases.
Wow. It's like you have a crystal ball. That's amazing. That's a huge. What's the percent difference? I'm trying to ballpark it. Is it
0.17 percentage points off?
No, well, yeah, that I'm saying from the original publication to the actual, right? It's like a 30%, 40% increase.
20-ish to 64-ish, yeah.
Right. Okay. Yeah. I mean, that's incredible.
Yep.
And this aligns more with what we've seen from the UK.
Yeah, other countries.
Yep. Right. Yeah.
And it still may be on the lower end because of the vax record matching imperfections. Like you're never going to get to 100%. But this is, do people really know this is happening? I mean, it's one thing to have the issue of vax record matching, but do people know that there's a net 192,000 change? When I say net, I mean 100 added to one side, 92 removed from the other. It's 192,000 net shift from unvaccinated to vaccinated. That is, and nobody reports this. Zaynep won't acknowledge it. Stephen Dennis down in Florida or whoever he is won't acknowledge it. They just keep reporting the newest curve. And if you think about it, it's like my analogy is a tidal wave. The tidal wave pushes through. It's temporary. Everything falls back down to normal. And they never show that, it was actually normal. Now, the difference with tidal wave is it's real and that wave does do something. In this case, it's a fake tidal wave. The tidal wave is never there. It's just a statistical anomaly that's temporary.
You know what it reminds me of? It's not exactly the same thing. I recognize this, but it's like the whole reported deaths versus week of report versus week of when it actually happened, right? Or like the harvesting of past deaths that occurred. And so that like these daily numbers that you are getting from your states every day, it's like people think that that's the number of people that died the day before. But no, that's not the case. They could have died the week before, 2 months before, right? So it sort of reminds me of that, where like we see kind of one curve, but that's not the actual curve, right?
Yes, that is a good analogy in the one way that it distorts the current view of what's happening.
Sure, right. And it's being used to stoke alarmism. I mean, that's what makes it so awful.
But the case where it's different is whenever those reported deaths occur, it doesn't matter when they occurred on the epi curve necessarily because they did occur. The difference here is they did not occur. I mean, the cases occurred, but they're actually vaccinated people that you didn't know. So it's sort of like a different illusion, but it is similar that the part that's the same is that the initial report is misleading.
Right.
That's it.
Exactly. That's what it reminds me of. Well, let's see hospitalizations.
All right.
So you were a little off there, but not by much. I mean, it's still increased substantially.
Well, the part notice the total went down. So that's the part I didn't anticipate.
Oh, yes. I missed that.
That there's less total for 224 now, for that date than there were in the 210 release.
Why?
So where did they go? They might have gone into the partially vaccinated bucket that
isn't reported at all, right?
Isn't reported, so we don't know.
partially, that's the same with Chicago, by the way. And they say it in their notes. Now they say it that the partially vaccinated are not included in the database
Right.
or in the
So
data
that's my
set.
best guess. I don't think they disappeared or moved to a different week. I think they went into
Got
the
it.
bucket that is
That
excluded.
makes sense.
So even though the bar is further left, it's actually still closer to the total percentage. Now, I estimated the outcome would be around 53, 54%. I'm sorry. I don't remember the exact raw numbers, but I was off by 2 percentage points. So it was very close. You know, it was like I estimated 54 is 52, or I estimated 52 is 54, whatever. And by the way, these aren't done. They're still going to keep shifting towards vax in future weeks. Maybe not a big change, but that blue line is going to keep going. It won't go to the left. It'll only go right.
Can I ask a technical question here? I'm sorry to nitpick about this a little bit, but why do you say matched instead of verified, or like fully vaxxed hospitalizations verified? Do you know what I'm saying?
Well, I'm saying matched because I'm trying to stick with the vax record matching.
Okay.
I'm trying
Well,
to keep
because
that.
the partially vaccinated that are, we assume, are taken out of the data, they're matched as well, but they're matched to a partial dose, right?
Well, they're not matched as a vaccinated person. They're
As a
considered
fully
not
vaccinated
Yeah.
person. Yeah.
So yeah, I could, but
Yeah,
I'm trying to use vaccine. I'm trying to make vax record matching part of the normal lexicon.
Right.
Like I want people to
Right.
know it and be repeating it and asking the question all the time to their Department of Health, to their commissioner.
Yeah.
Tell me how you do vaccine record matching. How do you know someone was vaccinated or not? How are you coming up with these numbers, and tell me the process end to end?
Got it.
And
Okay.
how accurate is that? So
Yeah.
anyway,
Yeah.
so let's do deaths. And again, it's an illusion because I thought deaths would go up higher. You know how deaths take longer to report, and I've
Mhm.
witnessed this
Yeah.
in the New York City data. Is you see how the first week to the second week, look how much it jumped. The total went from 400 all the way to 900 and something. I incorrectly anticipated there would be another 400 added, and then I split those. Instead, they only went up by a little, you know, from like 950 to 1,020 or something like that. And I estimated 54%, and they're currently 48%. So I was off by 6 percentage points, but it's still right in range. And again, deaths are the last one to get matched or successfully. So they are the most laggards, or they lag the most. So this one could still move towards my 54%, and it probably will, because the week before it is 53%. So it's unlikely to be very far off.
But are partial, so what do they do, especially with deaths, right? Because if somebody's dead, they're dead. But what do they do with the partially vaxxed person who tested positive for COVID? Like, is that, and who died, you know, who
Well, they go
died
into the
COVID
partial.
positive?
They just don't show up in.
They don't
this
show up
chart.
there, but they show up in their total COVID deaths number.
Sure.
Right? So that's interesting. So maybe there would be a way to back into the partial vaxxed COVID deaths.
Well, the problem is,
or no,
they only give us a small subset of the total data. So I'm getting this raw data. I don't get this from the website, right? I get it from the GitHub repository.
Okay.
And in the table that provides all this, they don't tell us the number of total deaths, and they don't tell us the number of partial deaths or hospitalization cases. So
partial
there's
deaths.
no partially vaccinated
You died
deaths.
partially.
Yes. No, I don't want to make jokes about deaths, and there's no mild deaths. I know people have used that anyway. So if there's no other table where we can cross-reference to see, oh, here's that week's total cases, hospitalization, and deaths, because if there were, then I would be doing the math to determine what's that partial number. And I would put that in there, because in UK, I can show 0, 1, 2, 3 doses. And it's a different picture. Because when you say, oh, this is how many vaxxed, this is how many unvaxxed, but then there's a whole bunch of other deaths and hospitalizations that change the total denominator, and that changes the percentage of the total, and it makes unvaxxed look worse in many times, because you don't see all these other ones that are occurring in between, in the nowhere space. Well, here I know there's some in partially vaccinated, but the main point is that I was able to successfully determine that the vaccinated deaths would go way up, the unvaccinated deaths would go down, not from the first week, but from that second week, and that the ultimate ratio would be close to 50%, which, by the way, would still favor vaccination.
Sure.
Right? That favors the vax rate. But the difference here is more like a 3x, not 20x or 30x or 97x or whatever the CDC wants to tell us. So I thought this was pretty good. And I'm not a genius or anything. Like, this is just basic pattern matching. And I really just kind of went linear, a slight linear increase over time, which I'm going to show you here pretty soon that that's all it is. But if I can figure that out that closely, I mean, I was 0.17 points, percentage points away on cases. That's ridiculous.
Right.
But it was easy. It didn't even take some
this
crazy
isn't
algorithm.
fancy. This isn't like the fanciest math. I mean, I know people look at a graph and they're like, oh my gosh, this is so fancy. I mean, it's really a lot of descriptive stats. There's not a lot that's inferential here. I mean, you did a prediction, right? So there was some, inferential stats involved in that, but yeah, it's not, this is like a high school calculus kid could do this, like, or even lower.
That's about, best
I mean, no
claim.
offense. I'm not discrediting your work,
No, it's
but
true.
I mean, that speaks to the COVID data overall. And that's what I love about it. Like, all of this stuff is publicly accessible and anybody can download it and anybody can analyze it. And it doesn't take, like a PhD in statistics, right?
Right. Exactly. So you're right about that. I'm using basic math. I didn't use any special formulas or calculations, right? I didn't even use any of my calculus from Georgia Tech. I just did basic calculations. So this is a different view of the thing above. So above, I was showing you the raw data. Now I'm showing you it as rates, but I'm showing you on graphic form over time series. Now that yellow line is unvaccinated before the change, before vax record matching, and blue line is vaccinated. Now, look at those two dates, 1/8 and 1/15. Those are the ones that were highlighted by Zeynep and Dr. Spencer, even John Favreau. I saw quote tweeted. Yeah, John Favreau and a whole bunch of celebrities, like tons of people were quote tweeting the Stephen Dennis tweet that showed those charts. Totally uncritically, no idea what those charts even say or how flawed they are. But this was the chart that I thought that would get Zeynep and Cheese. Maybe not Cheese, but Zeynep especially. You see that the Big Dipper, right? That's what it looks like.
Yeah.
Looks like a kitchen utensil. That white line is the percentage of total cases that are vaccinated. So I call it vax percent of total cases. Now, you can see what's happening, right? We do expect that to increase over time as vaccinations increase, right? I mean, that's sort of natural. But why would you believe such a dramatic dip and then it goes back up? Like the 122 week somehow is sort of okay. Maybe it's because there were so fewer cases that it didn't take as long, right? Think about it. There's so fewer, there's like, a fraction of the cases to record match, whereas the other weeks are so voluminous that maybe they took several weeks. But I mean, if you saw this, I don't care if you're a math person or not, just visually, doesn't that look like an anomaly? I mean, it did to me.
Yeah.
And this is what I tried to show them, like, look at this. Do you think this is real? And do you see how the dip in the white line results in the spike in the yellow line? I mean, to me, visually, it just makes sense, but sometimes I have to walk people through it. Okay, so you guys get that. So, well, yeah, they don't care. And look at the numbers real quick. You see the 10,000 versus the 1670 at the bottom?
Yep.
That's sort of what a 7-to-1 ratio. Now, this is what happened when they updated the data.
Oh my gosh.
You see that white line?
Yeah.
I mean, that's all I did.
Yeah.
That's what I predicted.
Yeah.
Right.
Is that rocket science? So you see the white line go back to normal.
That's care is what that is. It's somebody who gives a shit about being somewhat accurate. Excuse my French.
Yeah.
But then you see the rate curves. Yeah. It's not like it flipped the rate. It just changed it from 7-ish to 2.5-ish.
Right.
I mean, something like that.
Right.
You could still say, look, unvaccinated, at least according to these data, are.
But also, I mean, just to kind of go back to the beginning a little bit, like the unvaccinated number still, or that definition still has problems, right? Like those problems are not resolved by the revision or the matching for some people, right?
And that's exactly the point. Is this is like best case scenario based on how much record matching they've done to date.
Right. It's not, oh, that's really good in the chat. John says it's not care, it's competence, right?
Yeah.
Competence cares.
Yeah. We did have a question real quick about the matching, if that fits in. I know you were just getting to that, but
let me, you want me to take a look? Did you?
Yeah, I'll read it to you.
Yeah,
IRS 719 asks, do we know if they're fully matched? Could someone's vaccine record be partial? If, for example, they received 2 doses at different places, but only 1 dose is on their vaccine record?
That definitely happens.
That
definitely happens. So there's definitely I mean, I can't go grab a record and show you because they don't show this, but there's almost certainly fully vaccinated people that are being counted in the partial vax and unvax categories based on that problem.
Yep.
You got vaccinated different places. You did 2 in one state, 1 in another state, 1 in one hospital system, 1 in another hospital system. One was uploaded properly, one was not. There's so many people that in my replies say, hey, I was vaccinated in California. I don't show up in the database.
Right.
Simple as that. Other people say,
Absolutely.
yeah, I'm fully vaccinated and I show up as partial in New York City. Well, guess what? Boom, takes you out of the numerator, keeps you in the denominator because, you know, they have the record somewhere.
Well, it makes sense too. Like if you sort of live through the vaccination effort, especially here, you know, in New York City or places like it. I mean, they had these vaccine, you know, pop-ups on like a street corner next to the dumpster. And like, you know, I'm not saying that the people doing that would purposefully, again, you know, try and fudge a record or something, but it's not the most, you know, military clockwork-esque operation we could come up with. It's been a little crazy.
Yep. So Eric and Jessica, I need to say something very important. You see in the chart title, this is because I don't want to mislead either.
Uh-oh.
In the chart title, do you see the blue highlight?
Mm-hmm.
So I, in this chart, applied the 2020 census to the unvaccinated line. So with the other census, that yellow line would be a little higher. It wouldn't change the vax one, and it doesn't change the white line because that white line is just, you know, a ratio of the two.
Sure.
Of the raw numbers. But I just want you to see that I have taken the liberty to put in the 2020 census so that that's what that yellow line looks like. This is not exactly what the yellow line would look like on their website because 1, they're using the 2019 census, and 2, they're age adjusting. Me, I'm doing it, hey, here are the raw outcomes divided by the population based on the census.
Mm-hmm.
But if you notice in the prior one, I was doing the same thing. So I'm just showing my formulation before and after. I'm not trying to show their formulation and then mine after. You know what I'm saying? Like I'm comparing like for like, but I wanted to make sure people knew that I am applying the 2020 census in this one, not 2021 or 2022. So it could be off a little bit in either direction. All right.
Yeah.
But you can see how much the shape changes. And by the way, do you see what I did? I kept the scale the same. Look at the scale. See, they aren't doing that. So you can't see the difference. You can see it.
When you change the scale, it's a crime against graphs. I'm sorry. Like these people should be tried for crimes and, you know, data crimes or something, right? Like, no, it's not. I mean, and people need to learn to spot those things and, you know, read a graph or compare the axes, but people don't, right? So it's on them. It's on, well, I know it's on the producer of the data to do that. I think.
And devil's advocate again, if you think about it, when Omicron hit, it went off their scale. So whatever scale they were using before, they had to go up. It's just when you come back down, that's when.
Right.
So, all right. Now this is the one that I think does it all, gives the story above all in one chart. What this is the blue was how the cases looked when they first released, you know, each week back through October 30th. And then yellow is how much changed from unvaccinated to vaccinated.
Right.
That's a huge percentage of the total, right? I mean, look at that. The black line is the percentage of population vaccinated. And you see how that's getting closer and closer. It's gaining on the population vaccination percentage. Now, and by the way, the yellow and blue represents the percentage of cases who are vaccinated. So that's what it is. It's blue was original, yellow is after, and the yellow area you see is how much it changed from one to the other. And you see those dips. Those were the dips that looked like huge spikes in the graphs earlier.
Right.
That were published all around the world and all around the country by media and everything. And this is why. And once they came back up after the fact, no one reported it and no one acknowledged it.
Of course not.
Yeah. And you can see the trend. I mean, I don't think this last week 129 is filled in all the way. I don't think 18 is still filled in all the way. You see how it dips? I mean, look, there's going to be some fluctuations over time, but I think it's going to still fill in more and go up. And anyway, does this make sense? Any questions on this one?
Yeah, no, it's fascinating.
Is this the pterodactyl?
It's the pterodactyl. Yep. There were multiple people in different chats that said, all I see is a pterodactyl. I don't know what that is.
That's so funny.
Okay. Now this one is the black line again is the vaccinated percent of population, just to track along the way ever since April.
Trend. Yeah.
But these three different color lines are vaccinated percentage of cases, hospitalizations, and deaths. And you see they track pretty well and they continuously go up. But the anomalies you see at the end are the same dips. Again, those dips that were artificial and then led to insanely high spikes on the New York City Department of Health site, which were then repeated all around the world. You ready for the corrections?
Yep.
Yes.
So that was the reported. What was originally reported on those days?
Right.
That's the other one. Okay.
Right. And I don't have the originals all the way back. I just put in what, because for me to get the originals, I have to go through every version history of every file and find when they first reported that particular week and then record it and then try. So I only went back to.
Why is the vax percent of deaths so high in the summer? I mean, there's fewer deaths overall in the summer, right? In New York, right?
I wasn't tracking back then, so I don't know how accurate that is because look how much it drops in July, later in July, and then
yeah.
I think of this more as a trend, not so much.
And it's still report, right? They don't organize this data by date of occurrence, or do they with the deaths?
No, not for this. These data are the week that the outcome occurred.
Okay.
So within this week. This is when someone tested positive or was admitted to the hospital or died.
Okay.
And what their status was at that time.
Got it. Okay.
So it's not based on data report, which is good.
So it's occurrence. Okay. Gotcha.
So now I'll fix it. Boom. Go back and forth. Obviously a mess, which I don't know why anyone would think that's reasonable to report, right?
No.
And then pow. And you see that yellow line is going past population soon. I mean, and that little dip may even fill in. I think the blue green, see how they both fall at the end? Again, I think that's just, they're not all the way filled in.
Yeah.
They're on their way.
Yeah. Well, and it just clearly, and it matches the trend line. I mean, maybe this is what people would expect. I don't know. But like for anybody who thinks that the vaccination stops transmission, I hope nobody thinks that. But like, I mean, it's reasonable for somebody to look at that and be like, well, actually, the more vaccinated the population is, the more cases we see and hospitalizations and deaths. And
Well, and in this case, it's the vaccine percentage. The raw numbers don't necessarily go up, but they did obviously in September, December during the winter surge and all that. But I mean, early on, you could see there's a bigger gap, and there seemed to be an advantage beyond just the vaccinated. It's not just one for one, right? There's an advantage even beyond the vaccinated percent, but for whatever reason now, whether it's the transmissibility of Omicron or vaccine immunity escape, whatever, it's going up faster and faster. But we're getting more and more of the reports of this 95% efficacy and 97x, right? I mean, why would they be doubling down on something that's obviously false when the efficacy is going down? So as it goes down, they're touting much higher multiples.
Yeah.
I don't get it.
I don't get it either.
Okay. So that's all the New York City stuff. I know it took a long time to go through it, but
that was good.
It really helps to talk it out, and I can refine how I describe it and explain it. But I wanted to give you a quick change over to UK because I've been trying to.
Super quick. I mean, it is complicated, and that's why we wanted you on to help us go through this. And again, I keep referring to it as the weeds, and it certainly is. But this is the work that the Zyneps don't want to do, right? This is the work that a lot of the blue checks, I don't know if they're lazy or if there's this noble lie aspect to it, but the scratching beneath the surface, really doing this hard data work. I mean, I'm so glad that you are doing this because there's not hardly anybody else that's doing this.
Well, and I think
we pay a lot of people a lot of money supposedly to do this, and they're not doing it.
And I think it also shows that, like, hey, Clayton Cobb, like, you might not really know his name, or hold to LLC, but like, yeah, he appears to be like a rando on Twitter, but like, look, he's taking a lot of care and a lot of time, and he's going through this. And I think, Clayton, you've always invited analysis or critique or discussion on your account. And it's like, look, if you're going to take issue with this, don't attack this guy just because he's, you don't know who he is. Like, engage with his ideas, right? Like, he's gone through and he's really analyzed this.
Numbers.
So, the phrase I use on Twitter a lot is like, well, do your homework before showing up to class, right? So, I mean, do the homework first, come to class, then you could engage in the discussion. But as we all know from school, there's nothing more annoying than, somebody trying to overtake a discussion who hasn't even read the book, right?
Yeah.
So to speak, right? Or hasn't even done the math. So I think that's what this helps show people as well.
There's another part of that, Jessica. It's that partial preparation. So there's some people that have found some pieces of information that put my claims into question, but they're just one piece of a puzzle, and I've already thought a couple of steps beyond that,
Sure,
and I
right.
did account for that, but they don't
Right.
know, or they haven't looked at my past tweets. And instead of saying, hey, I saw this, I don't really understand it, how does this affect what you said, can we work through it together, which would be a great way to do it. Like, I'd love to collaborate like that, especially with someone who is skeptical of these outcomes. Think how much we could accomplish. But
Sure.
when somebody comes at you and tries to take you down and call you a so-called, or they insult you, and it's like they immediately are on the attack, and they think one little thing they found invalidates all the research you did, and you're just like,
Yeah, it's
I can't even
frustrating.
have a
And they mute
conversation.
or block you.
Yeah, well, or yeah, and that's the thing, or I mute them, but I don't block anyone, by the way, because I don't think that's right. But yeah, it's come with care and honesty. Give me the benefit of the doubt. I am biased in that I don't like this stuff. That's where my bias comes from, right? I think we're all biased, but I don't come at it. I don't ever talk politics. I never talk about Trump. I sometimes get upset at Biden, but it's like him announcing there's a 97X.
Sure.
You can't do that.
Right. Right.
I mean, Trump did stupid stuff like that and said stupid things too, and I didn't like that. And I stay out of politics, except I promote, some of DeSantis stuff, but it's not because I don't care if he's Democrat or Republican. I just like the freedom and being able to think for myself and be given the transparent information so that I can make personal risk decisions, not be coddled and told what to do and forced, and have my kids forced to do what you guys know all about. So
Right.
if people come at me with true curiosity, intellectual curiosity, and have some questions and some holes to poke because they want to understand it better and want to make sure it's more accurate, I'm all for it, because I don't know all this. I don't know how much the population went up, then went back down, but I'm quite certain based on my research that it's higher now than it was in the 2019, right? So that's definitely hurting unvax. And then you have the vax record matching, which is outrageous, as you can see.
Yeah.
And we're off kilter with other countries, but there's some countries where we're more on kilter. Switzerland, who I haven't looked at their data in depth, and maybe that would be a good place to look. They have similar ratios as us, but why is that? Why would some have similar, others be dramatically different? And then when we get to the nitty gritty of our own data at the state level, like Georgia, who I researched with Kelly yesterday, we keep seeing 3 to 5, 3.5 to 1, 3 to 1, 2 to 1, 4 to 1. So I don't know. There's just too much tribalism.
Mm-hmm.
And I'm,
Right.
I have my tribe. You guys, I love you guys. You're awesome. And we're on a tribe, and we are at a point where we just don't trust anything that the CDC says or any Department of Health. And that's a problem, because there may be some genuinely good things that they're putting out. Like, maybe we should all be fighting together to get the 75 and older demographic vaccinated in New York City. Or maybe we shouldn't. Maybe we should just make sure they know and that it's clear, and they make their own damn decision and don't change all of society based on their decision.
Or we shouldn't assume that all those people 75 and older even are medically eligible, or they're, they might have certain convictions or certain matters of conscience, right? And so who doesn't in the United States now know that the COVID vaccine is available? I mean, come on, give me a break, right? But
and how many people are not doing it because they don't trust and they're wearing a mask thinking that? I mean, we've seen those stories of people that I'm fine, I'm wearing my mask, I haven't gotten a cold in 2 years, and I don't trust that vaccine, and they're walking time bombs. They're, they're of the age or metabolic health that is the most susceptible to having a poor outcome. And they think a mask, which is also part of the public health messaging that has been horrible, right? So,
that was the pandemic playbook as well, right? Or they threw out the pandemic playbook and did lockdowns and all that other stupid crap. But they threw out the vaccine playbooks as well, because the original vaccine plan was to roll the stuff out because it was so quick and so novel, and we were kind of accepting the fact that we didn't have any long-term safety data on these things. And the original idea was to only go to the at-risk and immunocompromised and elderly populations. And that, as soon as the vaccine started rolling out, in New Year 2020, that just went out the window.
Yep.
Right. Well, and then you had Biden, literally. I mean, I have the tweet saved somewhere where he's like, mask or vax. Do you remember that? Do you remember
because he
him
said it
saying
funny. It was
that?
like Max or Vax.
Yeah, he did. He did. Yeah. And then Phil Kerpen made fun of it for months. But what he's doing there is like he was making those equivalent, right? Like, so either you get the vaccine or you wear a mask. And it's like,
They
no,
shouldn't be on the same, even in the same conversation.
no.
Yeah.
Even people who believe in the efficacy of masking should have a problem with that messaging. Or even if you don't believe in the efficacy of the vaccine, and I'm not here to debate that, at least in this episode, but you should still have a problem with that, right? So
Totally.
Jessica, it's
It
still
undermines
happening.
it.
It's still happening. Eric knows we have a kerfuffle in New York City with, a brewery that is trying to get canceled, and people that in New York City that really think vaccines should be required, they're saying, well, if you're not going to require vaccination, then you got to make sure those people are masked. And it's like they still think that's some type of equivalency. First, they think they're fine being around people who are vaccinated, not realizing that is only putting them as just as high of risk to get infected as
right,
otherwise.
right.
And two, that they think, oh, these 5 people who are unvaccinated wearing a mask is going to change my risk profile. It's just, the messaging is horrible. They've
It's so
completely brainwashed so many people into believing something that is not right. And it's taking away from the vaccine message. And then because it's taken away from the vaccine message, then they are hyperbolic about the vaccine results in an attempt to coerce and misinform people into getting it for reasons other than the true risk profile. So, and that's without even getting any potential adverse events, which I don't talk about, right? I don't get into that, but it's not okay to only talk about the efficacy on the positive side and not compare it also with the potential risks, because there are some.
Agree.
So,
and it just on really quickly on that point that you just made, an interesting thing is happening. You have what has become mask Twitter, right? Or these mask influencers. There's a guy, I forgot his handle, but he's like Captain Mask, and he has a YouTube, channel with like way too many viewers, and he reviews masks, and he talks about like how to, make sure it, there's a seal all around your face. But there's a lot of these people on Twitter with various amounts of followings, but they have actually started to push against the vaccines because of exactly what you're saying. And so we're seeing almost like a flip on the other side, because they're going, the vaccines are not delivering the efficacy that we were promised. Therefore, we have to dive into like perfect masking. These are the ones that want N95s for everybody. So all this dishonesty and all this right, it's really continuing to cause very harmful tales. Yep. It's messy.
Over a virus that 99.9+% of people survive. That's amazing.
It's probably like 99.5, but
yeah, well, I was at 90 whatever, but yeah, of most people, right? Of people
that's
under,
if you take all people and make them equal, right?
Exactly.
It's worse for a small portion and much easier or better for a large portion. But anyway.
Right. Yeah. Driving a car is riskier for my age group and my health anyway. So that's all I know. So what's this chart? What's this graph?
So I'm going to explain this in a second. I want to answer Perseus's question from the chat. He asked, have these independent charts been shared with policymakers? And that's a great question, and that's what I need help with. So that's why we did the Blaze article, but that's the only, I guess, known entity that was willing so far to pick it up and do something and put it out there. We've tried to get multiple media publications, from the New York Times to others, and of course I don't know any, so I try through my contacts on Twitter. I've tried New York Mag, New York Post, and there's some interest, but they haven't gone beyond interest. Blaze actually did something. In terms of actual public health people, I've been submitting tons of stuff. I even take these charts and I ask these questions, and I just get mostly dismissed or really light answers on their GitHub. Now, GitHub isn't the best place, right? That's just like the data team, but I don't know how to get it in front of people that matter. Like, who is the manager that would look at this? I can't get Commissioner Chokshi to answer. I mean, he's too high level, and he probably doesn't even write his own tweets, right? I've tried to get New York City Healthy to respond. I don't know how to get it in front of someone besides just sending an email to a random email address on the contact page, which probably won't get in front of anyone or get any attention either. So the answer is, we've tried. We don't have a really good outlet. What I really need to happen is, I'm super appreciative to Blaze and their CEO and everyone, and even Steve Dace, who took me on for 20 minutes in his show to talk about it, but that it's almost like preaching to the choir, right? A lot of people that read that and listen to that are going to already be super skeptical. They don't even care about the data. Like, I don't even have to see the data. I know they're lying to me. It's like, okay, that's not really what I'm trying to get to. I'm trying to get to people that are conscientious. And like my friend Mitch from my story that a lot of you have read, his name isn't Mitch, but he's a local New York, attorney who is smart, educated, and does have some doubt, but until he sees a smoking gun, he's just going to go with the recommendations of the experts. And if they say that we should all be masking indoors, so be it. If they say that we should wear them on planes, so be it. If we should all get vaccinated, so be it. And that's it. He won't look any deeper. He has to see a smoking gun that completely destroys the reputation or shows that it's some big conspiracy before he's going to start going against their recommendations. And I think there's a lot of people like that just don't have time. You guys talked about earlier, right? They're just regular people trying to pay the bills. Right? They're just trying to get through life. How can they do this much analysis? Well, I need someone that's legitimate enough to get listened to by that faction of people to be willing to pick the story up and do it with me.
You need somebody like I'm trying to think of like real clear, or like who does Real Clear Politics, Unheard, even ProPublica. If you get a journalist who's a little bit more balanced and maybe willing to just
think what a good journalist could do, who is not seen as contrarian, but is seen as trustworthy and not drinking any of the Kool-Aid in either direction, and just flat out puts the facts out that I have. Even if it's not quite painted in the seriousness in the way that I do it, maybe, but you can't avoid it. I mean, these are just clear, you cannot deny these facts. The only thing you could deny, and what I'm saying is, I don't know the population change, right? It's just an issue. I don't know the exact number, so nobody does, but it's still a problem. But the rest, the vaccine record matching, the way the data flips, that is just undeniable. And we can show it, and people need to know, and they need to know the effect it has. And then they need to know that that is just a microcosm in New York City of the whole in this country, and that the CDC data that they're using, that no one can refute, because how can they? How can anyone say, well, no, the CDC is full of crap? But I don't believe that. Well, then you just get labeled as a weirdo, right? I need someone that can frame it honestly and objectively, and I think it would work wonderfully. So if anybody can help get me in touch with someone, or if you are someone that does this sort of thing, contact me. I just want to get the truth out there, and I have all the data and science, the charts to support it. So anyway, that answers that question. Let me tell you what this means. This is an attempt at me simplifying one of my complex charts based on some feedback from someone. And the person that made the suggestion took this and made it even better. It's even simpler. It's got less words, and it tells the story better. But I'm not showing theirs. I'm going to show mine because this is my work.
Wait, who was it? Can you give them a shout out, or is it somebody that doesn't want a shout out?
I think it's Martin Sanchez. I think he's a PhD candidate for something, and he follows me. And we went back and forth like the last couple of days, and I made this new version based on
motivated followers are the best, right?
They're smart,
they're fantastic,
and conscientious, and not, doesn't seem, crazy, just a regular person that is paying attention. And he said, hey, here's this 538 chart that's so simple and clear, and anyone could look at it on their phone, on Instagram or whatever, and share it, and everyone would understand it. And none of mine are like that. Like
538 is Nate Silver.
Yeah,
just
Nate
to
Silver.
Clarify. Okay, yeah.
And so I mimicked his by doing the layout, and it's still not nearly as good because I got way too many words and stuff, but it is a little bit simpler. So let's look at the title. What percentage of COVID deaths are vaccinated persons in the US and UK? So it's, and in this case, I'm not just showing the percentage of COVID deaths, but the percentage of the population. So the black line is how many the vaccinated percentage of that population, so for 60 and over and 65 and over in the US and UK. And the red line is how many of their recent deaths are vaccinated.
Right.
So this doesn't make sense, right? So first off, let's look at the black line. For the US, 65 and over, it's 88.3%. Based on me going to the CDC tracker, going back to the date, these dates are the last 4 weeks of December, by the way. So basically all of December. And during that time frame, I kind of averaged it out for the 65 and over at 88.3%. Then I took the data from UKHSA and calculated their 60 and over, because they don't show 65 and over, they show 60 and over deaths. They break it down by 10-year groups. Okay. So that's why I did that. And theirs is much more accurate for my calculation because they actually tell me how many are vaccinated in every age group, and I was able to take those and weight the averages and come up with a number. Anyway, you can see they're within 4 percentage points of each other. So the black lines are really close. But then the red lines are what each country is telling its people. This is what they're telling their populace. Is UK is saying 75% of our people at this age, these 4 weeks, were vaccinated. 75% of deaths were vaccinated. The US is telling us, the CDC is telling us that only 33% of the 65 and over deaths were vaccinated. Now, how could it be?
The percent is percent of all COVID attributed deaths, correct? The red bar is?
For that age group. Yeah, for
For that
65
age
and
group.
over.
Yeah, for that age group.
So
Yeah.
within this age
Yeah.
group, 65 and over, for the month of December, only a third of the US COVID deaths in that age group were vaccinated, but 3/4 of the same in the UK.
Yeah, it doesn't work.
It just isn't possible. And this has nothing to
Defies-
do with population denominators, really. I mean, it kind of
No.
does because the vaccinated population percentage is based on, denominator. But this is just flat out raw data, and the CDC provides that raw data. I didn't just make this up. I took the raw data from that big chart where they try to claim the 97x and 41x and blah blah blah, and I took the raw data and I determined that they only count 33%. They're trying to get us to believe that only 33% of the COVID deaths were vaccinated people. And the UK, it's 3 out of 4. So which one is
Illinois
wrong?
runs about 40 to 50% in any given week since August.
But is that overall, or is that for 65?
That's overall. I mean, 80. They say 87 or so percent of those deaths are age 65 and over, versus under age 65, right? So, but that's what it's running, like between 40 and I think at the high it was like 55% of reported COVID attributed deaths are among people who are fully vaccinated.
But see, my question is really important. I said, is that overall or 65? And you said overall. But then you said 87% of the deaths are of a certain age.
Right.
Well,
right.
Let me show you what that distribution looks like in the UK. These are raw deaths by age group.
For fully vaccinated?
Every status.
Oh, I see. Okay, yeah.
Green is 3 dose, blue is 2 dose, yellow is 1 dose, and red is unvaccinated. Now look at the distribution. Look how many are above 80.
I mean,
That's
it's
bonkers.
the same distribution of just all cause.
Yes.
Mortality, right? I mean, it's what we would expect, and it's the same distribution roughly of just all COVID deaths or pre-vaccine COVID deaths. I'm saying the curve of it, right? Right.
Well, and this is not unnatural, it's normal, but when so many of the COVID deaths are concentrated in one area, then you need to see that area's breakdown of statistics to make any decisions. If you just look at the overarching average and say it's 40%, 45% or whatever, that's not helping us. And remember, I did 60 plus and 65 plus. If you look here, look how much green and blue there is.
Right.
But if I was to do the same US one, which I can't because they only have a 65 and over, they're trying to make us believe the red is vast majority of those bars.
Right.
How can that be possible? And again, that has nothing to do with population denominators. That has nothing to do with how they determine their population and we do. That's clearly a classification issue.
Well, that's why I say the rate stuff drives me nuts. And I understand the value of seeing the rates, but I just think that when we've spent 2 years getting raw numbers thrown at us, do you know what I'm saying? It's like, well, let's see, has this affected the raw numbers? Right? Or the general question of, is this what we would have expected? I think that's I'm not here to say the vaccine does or doesn't work, whatever. People can get vaccinated or not. I don't really care what you do. But, is this what we expected? That's all. Is this what we've been sold? I think that's I think Justin Hart asked that question. No, it's not. It's not.
I can
it's
answer
not.
that. No.
And you locked up my kids and forced them to cover their face, right? Like, and everything else, right?
Bankrupted my business.
Right,
you
exactly.
Screwed up the supply chain. Yeah,
exactly. For this, right? Like that's the issue. This isn't just some pie in the sky research study, like we're a bunch of epidemiologists just kind of studying this. I mean, this had huge policy implications, right? And effects on people's lives.
Yep. Well, and the reason why I wanted to show these is, can you look at the little combo statistics I put in the box there? Just read that real quick, just to give perspective.
Which one in the center? You mean in the very center?
Where I actually did some calculations there to just do some comparisons. So there's two
Those
comparisons.
are all deaths, all COVID deaths, all cause mortality. What is
so
that?
this is
What's all
the
deaths?
UK COVID deaths for the last 4 weeks, in recent 4 weeks, and you see the distribution by doses in the bars. But in that middle box there, you see how I say there's more 3-dose 80 and over deaths to COVID than all other deaths of every status below 80.
Yeah.
Just think about that.
Yeah.
More boosted COVID deaths for 80 and over than every COVID death for every other age group below 80 combined. No matter whether unvaccinated or vaccinated or what.
That seems important.
And then the next one, even the 2-dose 80 plus deaths are more than all the unvaxxed deaths in every age group combined, including 80 and over.
But that's true of deaths, right? I mean, especially over age 80, right? Like you have a higher chance of dying, right? The older you get, and everybody has to die. Everybody has to die of something. I just continue to worry about the deaths continuing to get attributed to COVID if that is not really what was causing the death, right? I mean, that's my issue. Yeah. And then we're taking all these deaths of 80-year-olds and we're, doing everything we can to make sure that, we test them for COVID. Do you see what I'm saying? Like for me, that issue still is not solved.
Well, and you're right. And that's what I'm saying. This is not a surprise. But I think it would be a surprise to most people who go around saying, hey, 95% of deaths recently are unvaccinated.
Sure.
Yeah, I think
absolutely.
I think that this is surprising, even though I knew this, to see it laid out like this is pretty damning, honestly, because it really flies in the face of all of the messaging that we're getting. And to your point about Mitch, it's like, am I going to believe this or the CDC?
Right.
And that's the problem.
Right.
Yep.
Right.
So anyway, part of why, Jessica, you said it's expected that 80 plus, that's where most deaths occur. It's just kind of natural. The part that's surprising, potentially just based on the messaging, is that, I'm going to say it again, the 2-dose, right, fully vaccinated, 80 and over deaths, that 763 is more than the combined total unvaccinated deaths for that same time period over every age group, including 80 and over.
Right.
Now, 80 and over, unvaccinated is very small. It's like less than 5%. But the 2-dose isn't that high either, because most of them have already gone to their booster.
Right.
So this is not the messaging we're getting. And I don't want to show this to show that the vaccines don't work. That's not even the point. This isn't rates, right? This is where people say base rate fallacy, base rate fallacy. No. I'm showing it this way because this is a meaningful view. Because people do go around after seeing those crazy New York charts and say it's 95% and it's a 30-to-1 ratio. Like, they don't understand the rates they're even looking at. When you look at what's really happening, more dying that are vaccinated, more in the hospital that are vaccinated. It's just a fact. Right. And it's because it's so heavily weighted in the higher age groups where maybe the vaccination efficacy isn't as much, or maybe it is high, but there's just so many people dying anyway, right? And they just happen to be vaccinated. It just is. Now, remember, this isn't just all-cause deaths. This is vaccinated. COVID deaths.
Right.
So I don't know. I just wanted to show this because people don't realize it. And how can our data in the U.S. be so different? It can't be. Right. Unless we're going to assume the UK counts a ton of COVID deaths that are vaccinated that they shouldn't. I don't know what mechanism would do that. But we have a lot of evidence and definitions and footnotes and classification definitions that say the U.S. does it this way, and we have very poor tracking mechanisms, but unlike the UK where they have a single healthcare system. So it's more likely that we're way off. And it's not okay to be way off if you're going to then create policy based on being way off.
Exactly. I think, again, vaccine efficacy aside, we don't even have to discuss that with this data. The 2 points really for me are, this contradicts what the messaging has been, right, from public health officials and from, your governor and your mayor, etc. And it's just for me, it's just another look, or it's just more evidence of definitional issues, if nothing else.
Yeah.
Right. If nothing else. And it corroborates, the other problems that we've been seeing all along. So, I mean, I find comfort in this to a certain extent. I don't know how long it'll be, but I'm like, yep, the truth will out, right? Like they're not going to be able to hide from these issues forever. And I think they know that. And who's they? I don't know. I'm just using the,
Yeah.
that pronoun,
infamous
right?
they.
They.
Who's they?
Yeah, who knows?
I've been
Who
asking that for
knows?
2 years. Who the hell is this they?
Who knows? Who knows?
Are you guys ready for a chart that I haven't put out on Substack or
Is
Twitter
this
yet?
breaking? Is this a breaking
Is
chart?
this breaking chart?
I've been
Okay,
holding
yep.
it back
Yep.
because it's very controversial, and it is very much dependent on how the UK or UKHSA choose what denominator they choose, just like the US. And they explain in their chart or in their report why they use the certain database. It's called the NIMS database, and how it's more accurate than the ONS database. But then, anybody that doesn't like low VE, vaccine effectiveness, says no, that is a terrible database, and everybody knows it, right? They don't even entertain the explanation from UKHSA. I think it is true that the NIMS database is overcounting, so the denominator is too high, right? Which is the opposite of the US. But then the ONS database is from the census in 2011, and it hasn't, and it's the same one since then, so it doesn't change or fluctuate, whereas the NIMS one is constantly moving, and they're able to adjust it and move it. But the reason why the NIMS database is considered overcounting is because it counts people in their system that have a NHS ID, and some of those people have moved, like maybe they don't live in the UK anymore. That's true. So I acknowledge that. That's why I've been hesitant to show this, because I'm just showing what they put out. This is the official, like the CDC of UK. And nobody really questions the CDC putting out their crap. I mean, we do, but nobody real does. But yet, when the UK puts out their data, it's, it can't be trusted because they don't use the right data. I just don't understand. Like, why can't we apply the same rigor and scrutiny to both sides? So what I'm showing here is just using their data as is. I haven't changed their denominator or tried to manipulate it or average it out. I'm just showing it based on the data in their reports. Okay, I want to be very clear about that. Oops, it's a little big.
Is it off the screen a little bit?
Yep.
Yeah.
There we go. I'm gonna shrink it a little bit more, get it into the window.
Okay, deaths per 100K by number of vaccination doses. Got it. I got it. So 3 doses is green. Yeah. 2 doses is.
Did you have a similar version of this maybe earlier this week or something? Is this an update or is?
Well, you might have seen a draft of it, but I haven't put it out in anything, Substack or
you saw it in a chat.
I did. It's pretty. I love the colors.
Well, and what is your takeaway?
I mean,
or takeaways?
It looks like the one we just saw. I mean, it makes, I mean, I don't know that I would say it makes the booster look good, but I mean, go ahead.
Yeah, that's what I was going to say. There's something, the difference between the green and the blue is what stood out to me the first time I saw it. And, we've heard differing things on sort of the efficacy of the booster. And obviously I think that, I would be willing to give it the benefit of the doubt that they claim. This chart seems to point to that now.
Well, let me take you guys
but
down.
It doesn't account for time, right? Right. So, I mean, let's look at this chart again in 6 months, right?
This is early returns, so to speak.
Right. Yeah, that's what I'm saying. Yeah.
Let me guide you down some key details that I think I see, and see if you see it. So first off, let's just look at green and red, left to right. So green and red, if you look at 80 plus, what is that multiple? Just under 3, right? 3 times 90 is 270.
Right,
So this is
right.
like a
Yep.
just under a
Yep.
3x.
Yep.
Okay. That is kind of what I've been talking about with the New York City data, right? And just the whole commentary. Let's say the denominator is a little high for unvaccinated, then maybe even if we make that 350, which would be a pretty large increase, like 40%. Well, then it's still less than 4x. Okay, that's reasonable too. Now let's go to the next one, 70 to 79. This is a little bit more multiple. It's more like 5 to 6, closer to 6x from red to green. Okay, maybe that's the place where it's most important because the 80 plus are just, much more closer to death, and 70, 79 is, there's a lot more people that would not die that if they got COVID, you know what I'm saying? Like if they were vaccinated and would have a better reaction to COVID and not die of other things, like, maybe that's a good reason to do that age group and focus on them. Now let's keep going. Now let's go to 60 to 69. That one is about 5, a little bit over 5. And then you just keep going, right? I mean, it's still in the 5 to 6 range, but it gets way lower below 50. Below 50, you almost can't see these, right? And that's what's important about scale. Let's go to 30 to 39. If you do the math between green and red, you see how it's 0.2 and 0.74.
Mm-hmm.
If someone wants to use a multiple, they would say, oh, you're 3.5 times or 3.7 times more likely to die if you're unvaccinated.
Right.
Which is true in this case. But what's the absolute reduction? It's a 0.54 out of 100K. Right. So out of every 100,000 30 to 39-year-olds, a half is going to die. Mm-hmm. Or we could say at 5.4 out of a million. I mean, and you're
I'm
not
more concerned about the one dose. I'm concerned about the one dose rate at 50 to 59 and 40 to 49.
I'm going to get to those.
Okay.
Don't be distracted. Don't be distracted.
Sorry. I get distracted by colors. Sorry.
Don't be distracted. Let's stick with green and red because in their report, when they show rates, they only show unvaxxed versus 3-dose. But they put the raw data in a earlier table and they give the population numbers in a raw file somewhere else, and I had to combine those to make the rates, but they only show the rates in the report for green and red. And if you go to the report for week 7, which I link, have in my source, they match. So these, when I say they match, I mean it's after all my calculations. I was very meticulous and careful about taking all their dosage population numbers across those 4 weeks, doing the math, weighting them appropriately based on the size of the cohorts, and then coming up with the 10-year population numbers, then divided the population numbers by the number of deaths for that age group and the dosage, because they give you that. And when I got done, my 0 and 3 dose matched within tenths and hundredths of their reports. I was like, I'm on the mark. So then I had more confidence that my 1 and 2 dose were correct because I did the same methodology, even though they don't show the rate, so I can't compare. They seem reasonable. Okay. So in the report, they show these ratios, ranging from barely 1 to 1, which is 18 to 29, like it's 0.21 versus 0.26, which is nothing. Right. But then you get as high as, 6 to 1 with 70 to 79. Okay, so it's in that 1 to 6x range for deaths in their report. Mine said that. And I just want to talk about that because if that's really what they want to compare is people who are boosted versus unvaxxed, well, I would be okay if this was the message. If they said, look, for your age group, here's both your relative risk and your absolute risk reduction. That would be great because they could say, hey, if you're below 50, there's no more than a 3.5x multiple for being unvaccinated, and that's probably not even lower if you're prior infected, if not all the way down to 0 or 1. But the absolute reduction is so infinitesimal that we just need to move on, right? You just make your decision and move on. Here's your risk. You know what it is. It's basically nothing. Leave people alone at college, leave people alone at their job, and let's just move on. Because if you look at how low those numbers are, if you go to the 70 to 79 booster rate, what is it, 14?
Yep.
14.63?
Yep.
You see that's higher than any dosage rate below 60?
Right.
So the risk of dying of COVID from 70 to 79 is higher than anyone of any
the risk of dying is. Do you know what I'm saying? Like I don't see any difference between this and the distribution. I have those charts somewhere in my files, but like this is what the curve is, right?
Like
Of
this is
death.
what you're saying. It's basically like this.
It's
Yeah.
right, or just of death of all cause, right? Like we all have to die, and so most deaths, are over age 80, and even over age 70. It's not even a contest. Like it's
Yep.
nowhere close in any given year. And I think that's a problem with a lot of this too, is that people don't have a perspective on, like, look, even in quote normal times, over 50,000 people a week in the United States die. Do you know what I mean? Of all there's no
No
context, and we're
concept of risk of everyday activities and no concept
right.
of how many people actually die on a daily basis.
Or
Now,
like people see a COVID death as wrong. Like if an
yeah,
80-year-old dies of COVID versus if they die of other natural causes, then that's a wrongful death. I
yeah,
don't know why
yeah.
we think that.
That it could have
I
been
don't get
avoided.
it.
That's what they would.
Yeah,
Right.
right.
So I think that the key is separating what truly is reasonable to say could have been avoided versus not. Because a lot of people that use that term, oh, this many could have been, they say the whole number. They're like, oh, it was 900 deaths and they could have been avoided. Like, no, they couldn't
No,
have. Let's focus on the ones that maybe actually were
sure,
avoidable and whether
sure.
or not that was related to a vaccine or not, because maybe not. And let's put our energy there and
Right.
focus on that smaller subset of either age-based or metabolic-based or whatever it is, comorbidity-based underlying issues that increase their risk
Mhm.
dramatically, and look at it like this. Because when you see the 90.08 for 80 and over, the green, the 90.08, do you notice that number is higher than every other unvaccinated
Way
number?
higher. Right.
It's higher than
Right.
all the red ones except 80 and over. So from 70 to
Right.
79 down, it's higher than all of those. So a boosted 80 and older is still dying at a
Right.
higher rate of COVID than
Right.
any unvaccinated age below 80.
But I would even not assume, here's my issue too. I would not assume that all the red in the 80 plus are even vaccine eligible. Right?
Right.
I mean, like
Yeah.
that's my, like, hey, you know what? If you're 80 plus, you do what you want. Right?
Right.
So, I mean, that's true at any age. I want all
When we
people
don't,
to do what
yeah,
they
and there
want.
are younger ages that are in nursing homes that are of the reasons incapacitated or not able, too frail to do, and we don't know. Some people
Right.
argue, oh, that number is so small, it's not even worth mentioning. Okay, it may be, but I don't know how in the world. Let me show you New York real quick. Do you see the red bars on the far right?
Right. Mm-hmm.
That's the raw number of unvaccinated for those age groups.
Right.
Look at them, compare them to the other
Right.
bars.
Right.
Why are there that many? Are you telling me they're all watching Hannity, which is what people try to say Fox News kills people by telling them not to use it? I mean, that's what people say. Is that what it is? There's a bunch of New York City old people that are sitting there like this, but all the 55 and the 35 and the 50 and all these, they went out and got it right away. But the 75 and older are choosing not to and
Right.
don't care. Well,
Right.
I want to know that, because if they are, why does their choice affect everybody else in this age group that is
Right.
under vaccine mandates?
Right.
And two, if they're not, well, keep them in the equation, but let's be clear about, well, that's where most of the deaths are coming from. So that yellow
Right.
line, I know I didn't talk about. Do you see the death rate? That's the yellow line is. Look at the numbers.
Right.
That's the death rate for COVID. It doesn't say, they don't tell us the unvaccinated or the vaccinated death rate by age. They just show the total. Well, look where, I mean, look, if it's 12 per 100K in 75 and over, and the vast majority of, well, not the vast majority, but the largest number of unvaccinated are in that group, then that's where the deaths are probably coming from.
That's
But they won't
right.
show us those
Yep.
numbers broken down
Right.
by age. So they just take the overarching rate.
It's been 2 years of this.
Yeah. And that's, so all of this is not okay. UK is giving us a much better look at it. When we look at it this way, I'm 46. You guys know I chose not to get vaccinated based on my personal risk calculus. And then I got infected and had 1 day of a headache and chills, and then, 4 or 5 days of light congestion that had no effect on me. And I didn't go anywhere. I wasn't out partying and I wasn't even going to the store because I don't have to. I'm fortunate. I'm able to do that. And I thought that was responsible to not intentionally go out and be around people. 3 people in my household got it, had the same outcome. We all hung out, we got better, and then we went on with life. None of us vaccinated, and now there's even less reason to consider it. And that's why I knew that these are the numbers for 40 to 49.
Right.
Yep.
And a lot of people 40 to 49 get it because they, good friends of ours that fight this battle with us that have both gotten vaccinated and boosted. And that's their personal choice based on
And they all got
evaluating the
COVID.
data.
Well, and
And
this is, let's think about this for just a second as we begin to wrap up, that, who is in the workforce? who is really in the workforce. By and large, it's 18 to 65-year-old. Yeah, I mean, there are some, especially in Congress, we have some people older than that are working every day, and I know people in their 70s that are still working.
Yeah,
I'm not saying they should be written off, but really, when you talk about the workforce that drives our economic engine, it's those people that are between 18 and 65 years old. And thank God that this virus does not, will not take large numbers of people out of the workforce. And that should be the government's interest when it comes to economic policy, right? But instead, Biden tried to coerce people into vaccination by issuing an OSHA mandate, which that was ridiculous, right? And who was he trying to vaccinate? He was trying to vaccinate the people who are in the workforce, not the people that are 70 plus, right? With that, like, did that make any sense? I mean, it was smacked down, thank goodness. Although, a lot of people did go get vaccinated who wouldn't have otherwise, right? Just
Yes,
out of fear.
Or coercion.
Yeah, it was coercion. Yeah. It was jab or jab, right? Or the specter of that, right? So
absolutely, and
ridiculous.
And I know we gotta run, but these last two charts you showed really dovetail with the Osterholm interview, especially the part about Israel. And I don't know if you saw it yet, Clay, but he claims that the vast majority of cases, hospitalizations, and deaths in Israel are among the unvaccinated. And obviously, we know about Israel; they're the most jabbed nation on earth. They're the ones that are already on 4. And it turns out that he was literally defining unvaccinated, using your chart here, as anything but green, right? And it's like, how is that helpful? And it turns out that even that definition of his wasn't as cut and dry as he claimed it was. But it all comes from this noble lie place. He really wants people to get the vaccine. He didn't want people to be hesitant, and so he fudged. Right. And he fudged from a place of caring. Right. But to say that blue and yellow equals unvaccinated
is ridiculous.
It is so unhelpful.
Isn't that what
right?
you showed me yesterday, Jessica? That person, was it media or one of the health people, saying 92% were one dose or hadn't done their booster yet or unvaccinated?
Yeah, no, that was a spokesperson for Advocate Health Systems, and in the Chicago area, and then they have I think hospitals in Wisconsin as well, right? Like in the Chicago Sun-Times was quoting her back in just January last month, where she's like 92% of people, and what she actually said are one dose. What did she say? Like unvaccinated, partial dose, or they're eligible for a booster and they haven't gotten it yet. So then scary number, 92%. Right. And all people hear with that, or all people even read, is just 92%. Yes. Oh my gosh, are unvaccinated and they're dying of COVID still, or they're dying of COVID because they're not vaccinated. That's the implication that they want you to take away. And it's irresponsible.
Same with masks. Yeah.
Yeah, masks, same. Well, Clayton, this has been awesome. Really. I mean, I love this stuff. I love in-depth. I know, Eric, you do too. I mean, we're geeks with this,
I love
right?
geeking out on this.
And I love that Blaze published your article. I love that we have, this 2.5 hour, like deep dive into this, because I always think about putting things on the record, right? So that in the future or eventually it's like, why didn't anybody say anything? Somebody did say something, right? And 6 months from now, who's going to be probably using this data and maybe not attributing you, unfortunately, is Apurva. What's her last name? Mandavelli from the New York Times, right? Like this will come out, I think, eventually in some way. But let's hope that, like I said, maybe ProPublica or David Zweig, is that his last name? Like somebody picks this up, and it really takes off, and you get proper credit, Clayton, for the
we'll make
work
sure
that
of
you've
that.
done. Yeah. Oh yeah. I will not let people forget, for sure.
By the way, Dave is the first person I went to, and he thought it was excellent, and very important, but he was, deadlines on his own.
He's working on a book, I think. So yeah. Can only do so much.
Yep, exactly.
And also, it's a very specific kind of article. It's probably not just one. You know what I mean? It's a thing.
Yeah.
Right. And I will point this out. I found this out recently, although I think I might have known it, but it just came back. But Charles Darwin was an amateur. He was not like a pro. He was not in the Royal Society of Naturalists and Biologists. He was an amateur. He did his work as an amateur, as somebody who was just passionate, smart, read a lot, knew enough, and he did his work. And he was absolutely censored. They tried to cancel him. They tried to smear him, and it's Darwin. So just remember that, Clay.
Okay.
Yeah, and I think the non-expert can often see things that experts are blinded to, right?
Oh, absolutely.
Because there's actually some good research studies on that, but just the fallacy of the expert, and we've certainly seen that run amok over the past 2 years. And some of the best work I've seen people do, or the best insights, are from people who are smart, right? Like Clayton, you're a smart guy for sure, but they come at this like they don't have preconceived ideas. Sure, they have biases, right? But they're not entrenched, and so they can see things in a way that the so-called experts can't. So
I think you make a great point, Jessica, and that's why I showed that quote earlier from the New York City healthy guy, when he just flat out says something that is statistically and provably not true.
Right.
And yet that is the basis for all of his beliefs and how he manages the data and how he scrutinizes it or doesn't. Yeah. In fact, he may scrutinize it in a direction that takes it away from something he doesn't think is true. Like, oh, why would our cases look so close? That's not right. We need to figure out what we did wrong, or like, how can we make sure this error is not here, and find ways to make it look better, not in a negative way, but just because it seems off base from his standard. Like the standard he thinks is there, he's pushing. It's about the Overton window, right? Like the Overton window is way over here. I'm trying to, can we, I'm pulling really hard to pull it over here so people go, oh, I see it now because it's in the window. Yeah, that's really what I need help with. So thank you guys for doing this. I had a lot of fun. I thought it would be 20 minutes or something, but little did I know.
It was not. It was like 2 hours and 20 minutes. It's awesome, though. It's awesome. Love doing this. So you guys have a great weekend, both of you. I hope you don't have too much snow, and get to spend time with your families. So good. All right. Take care.
Thanks.
All right. Wait, real quick. We solved it though, right?
We solved it. We solved it.
Okay, good. Great.
Check.
Awesome. Bye, everybody. See you next week.
Bye.